Going. Good evening, members, to tonight's Health and Adult Social Care Overview and Scrutiny Committee, the first one of 2025. So, Happy New Year to all of you here today, including officers. Can I have apologies for absence, please, Terry?
Thank you, Chair. We have apologies from Uni from Medway Health Watch. That's the only apology I've received this evening.
Thank you very much. Can I sign the record, members, of the meeting held on the 5th of December as being correct? Is that agreed? Agreed, thank you. I have no urgent business to announce. Are there any disclosable pecuniary interests or other significant interests or any declarations of whipping on tonight's agenda, members? None? Thank you. Before I start, I would just like to congratulate David Whiting on his appointment as Director of Public Health. Congratulations, David. I'm sure you've been a real asset to the Council, and I'm sure you're going to continue being that on this panel as well, so congratulations. As always, can I remind all those speaking tonight to keep introductions as short as possible. Members have read the papers, as I know they always do read all the papers. So please use your introduction just to update and give a highlight on anything maybe not included or to draw attention to the very key points. And lastly, I wish to propose to vary the order of the agenda tonight just slightly and to take the annual complaints and compliments report, item 6A first. And I'm pleased to say Councillor Murray's indicated she is happy to go second. Is everyone content with that? Thank you. So we go straight to item 6A, ASC complaints and compliments, please. Sandy.
Hello, good evening. I won't be giving an introduction because I think the report explains things for itself. So I think we'll go straight. Come nearer. Sorry,
Sandy, thank you.
Yeah, sorry. I think the report is self-explanatory, so I'll open it up for questions.
Thank you, Sandy. Questions, members, on the complaints? Councillor Wiley.
Hello.
Thank you. Hi, Sandy. Sorry, thank you. Thank you, Chairman, first. And again, I agree, David Whiting will be an excellent addition. So, thank you. Sandy, we always question you on complaints at this time, but first I would like to say that there are comments in here about some of the financial assessments.
I think my hearing aids don't like this sound.
Some of the financial assessments, they get complemented in this paper at 9.26. It says a relative thank to staff member in the client financial services for sorting out their care package. So I know this is an area that's difficult at the moment, but we are still doing good work as well. So I'd like to thank you for that. And
there's been quite a number of compliments for their self-directed support team. Sorry, I need to turn them down. They're not liking all this. Sorry about that, you're squealing. Yes, so it's not unusual to get compliments as well.
Microphone, Councillor Wiley.
thank you. And on page 52 at 4.1, there's 6 number of complaints have been withdrawn. Do we follow up on those complaints? Or do we just take them at face value?
If somebody phones or emails in to say they want to withdraw their complaint.
Michelle, can you just put...
Sorry, can't get used to it. We will, if it looks like there might have been coercion or something like that, we would phone them. But the main reason they're withdrawn is because there's been a prompt resolution. And they just phone to say, don't take it any further.
Your microphone's on again, Councillor Wiley, so thank you. Thank you. Is that okay, Councillor Wiley? Thank you. Can I just have, thank you, Sandy, so much. And Michelle, can I just ask, maybe officers, maybe Jackie can help, the poor communication, I mean, overall the report is really good. Well done as per usual on the assessment of that. I can see that you did comment in there about poor communication still seems an issue. And I don't know, Jackie, if you want to comment, because also the cost of care, people's idea of the cost of care and their knowledge of the cost of care seems to still cause some complaints. Are we resolving that now going forward?
Thank you, Councillor. I mean, if later on we're talking about the CQC report, and you'll see in there that there's some concerns that were raised about communication, and that is a challenge, and I think we've discussed that in previous committees. One of the things that Councillor Murray and I have talked about, and Councillor Murray's very keen on, is looking at what we can do from an assistive, not assistive tech, an AI, or sort of any sort of technical solution, because some of the reasons that we struggle with the complaints is the volume of emails that are coming into the social work teams and frontline staff. That volume means it's very difficult to keep on top of, and that's where the communication challenges arise. As an example, this Monday we had a provider come in and talk to us about what we can do differently, i.e. could we use chatbots, can we automate things, you know, how can we reach out to not just residents but actually to our providers, etc., to make sure that we're working in a much smarter way. So that sort of process is started to be undertaken. One of the things that I say all the time, Mike and Karen here, is pick up the phone. Don't rely on emails. Just ring somebody and talk to them. It's trying to change a culture. I think there's a thing of people wanting to make sure that they're covering what they're saying, but that's fine. Have a conversation and then put it in writing. So there's a real focus on what we do and how we change that. With regard to the financial assessments, communication, families are told at the very start when a social worker goes out to see somebody that they will need to pay for their care. The confusion arises when somebody gets reablement and so get up to 6 weeks care-free. And unfortunately, sometimes people hear the free part and not the up to 6 weeks part. And we also sometimes have some challenges, and this has been discussed with our colleagues in the acute trust around perhaps some of our health partners advising you need to go into a care home and you won't need to pay for it, which brings some challenges itself. So we're working with our health partners as well to try and resolve that issue.
Thank you very much, Jackie. Councillor Hamadishi.
Thank you very much. It's good to see that in terms of the general complaints coming in, it's rather stable in terms of the numbers. There's no real significant spike. I can't speak to that, I'm not too sure why. My question was to do with open up the channels. I know you've got a large volume of complaints already, and maybe having a deluge of complaints might overwhelm you even more. But if you were to go on to progress to AI and having some sort of way of crunching out, you need more volume anyways to make sense of things. So have you looked at channels such as WhatsApp as another method of gaining more feedback? And
So social workers already use WhatsApp. They use that potentially, probably more with our younger, the people that we support. The difficulty with WhatsApp is that we then have to copy and paste that information into their case note because we have to show every method of communication. One of the areas that we looked at when the council introduced the new, well, it's not new, the telephony system, it's a couple of years old now, is that's actually got an integration solution, so WhatsApp could be used, and then we'll look at how that would feed into the case management system. That's a little bit way off at the moment, though.
It's a good idea. The NHS are using it, starting to use it, and they're using WhatsApp Business as well, which links into your files and your systems, which is a good idea. Councillor Cook.
Thank you. Yeah, just a quick follow-up on what you just shared to Councillor McDonald's question, because what I wanted to ask really went with that. First, just say thank you so much for the report, and I was really pleased to see the compliments as well, and I can imagine the work that must go behind that, you know, breath of fresh air, relentless, not giving up, really appreciated. It was on that bit in 8.2 that says staff should make every effort to return calls, and it was exactly that, because you've just shared, Jackie, about, well, we encourage people to go on the phone, but we also see the volume of the calls, and I'm conscious that, you know, we've got Employment Matters in a week or so. We're talking all the time about staff training. You know, that staff should make every effort is different to there is an action plan to equip. So the action plan you've just shared around AI in terms of emails and response, but if in the interim, what we're talking about is when you can get on the phone, how can we be certain that making every effort doesn't become people are falling through the net? Thank you.
So I think if I just can take a little bit of a step back, when I came into post, I had 2 heads of service, and so actually 2 heads of service trying to manage a whole division was a challenge. We've got 6 now. That's been part of the right sizing has helped us to invest. We've moved commissioning in. That gives the team much more of an ability to focus on some of these areas, because it was, if I'm honest, constantly firefighting all the time. So having that additional resource, we've just completed our restructure. That's due to go live in March. So we've changed the way that the teams are working. Again, that gives some additional focus and some resource. Because we've finished that, we're going to, once we've finished putting people into posts as part of the restructure, we will then be going out to fill what's left of our right-sizing posts. So that means that we're bringing in that additional resource if we can recruit. And I have to say there's green shoots. So I'm positive that we'll be able to do that. I mean, I think Mike would say that if I don't say once a day or once a week, think about what it's like if you're trying to ring someone and you don't get a response, how frustrating it is. That's the same for the residents that are trying to get through to us.
Councillor Jackson.
This was just a quick one, and it was about complaints being brought forward. It looks like from sort of June or May to January we have where most of the complaints come through, and then like from February round to April there seems to be a drop in complaints, and I just wondered if it was because I don't know if you did see that, so you knew when there was like everyone knows don't go to A&E like Fridays and Saturdays because it's going to be. Is there the same sort of? Have you seen that maybe over the summer period going into the winter more people are complaining?
Sorry. Interestingly, things do tend to drop off they go a little bit quieter towards the end of the financial year, but that doesn't really align with the complaints unless they're catching behind. I mean, Sandy might have some info around any reasons or why, but I don't think there's anything specific, if I'm honest.
I've wondered that, and I don't have an answer, because I've always thought we had more complaints in the winter months when you're stuck inside and you can complain, but actually it's more like the summer months. I don't know, I haven't got the figures to see if there are more referrals in that period, but it's a fairly consistent observation, yes.
Michelle, do you want to come in?
Yes, we do try, or Sandy tries to capture categories of complaints to try to understand what they're all about. So I wonder if we could perhaps take a bit of work away and try to have a look and understand if there's a particular reason in those peak periods as to why they're increasing and what they're about, and then when they fall back down again.
Okay, thank you very much. I see no other members. Councillor Crozier.
Yes, sir, I wasn't quite sure where to ask my question, so I will answer it now because it is in the nature of a complaint, I guess. I can see, having been on this committee for some time, well, a short amount of time, I guess, compared with others, but for me, quite a long time, that the system is improving, and I can see from what Jackie says and what Teresa does that the system is improving. But I've had an elderly lady on the phone for me tonight complaining that she can't get an appointment at the doctor's. Can you tell me what I need to do in order to help that lady? Can I direct her somewhere? I feel I've got to sit with her and go through the whole kind of computer system with her and try to get her connected that. But for me, I think that's a real problem for the elderly population of Medway.
Yeah, if I have a conversation with you outside of this, then we can have a bit of a think, because she might need some additional support.
Thank you, Councillor Crozier. Okay, members, thank you so much, Sandy. Like I say, as per usual, a great report. Can I go to the Vice Chair, please?
I move that the committee notes the report.
Is that seconded? Thank you. Is that agreed, members? Thank you very much. Thank you. Thanks very much. Thank you, Michelle. Moving on to item 5. Thank you so much for attending, Teresa, tonight. As we said, obviously, if you wish to highlight just some small, quick items out of the report, that'd be great, and then we can open up to questions from members. Thanks, Teresa.
Thank you, Dan, and everybody for inviting me. And I think you can see from the report that it's been a really busy year. And there's a lot to read in there. I hope that people have paid attention to the thanks that I've given at the beginning, because there have been, you know, a real effort right across the division for adult social care and public services working together to try to improve things. And we've seen, I think, or we're starting to see for the first time the impact of putting in £2.5 million investment into adult social care to right-size it. When I came into post, the director was very clear with me that she felt that adult social care was inadequate. We knew that we needed to prepare for the CQC coming, and I drove the investment on that basis, but not just on that basis, on the basis that everybody in Medway deserves the best service that we can have. And you can see from the report later, and hopefully from my report, that that has been successful. So I'm very proud of all of the staff who've risen to that occasion, and also to the way that they have accepted that we needed much better and closer financial monitoring. That's been a huge change for everybody. The introduction of the FIT plan, after following our examination of the council's finances by SIPFA, again, when we first came into administration. And there really has been a very supportive attempt by staff to make sure that that financial monitoring happens. And I'm very pleased for Jackie and the senior team that we've now got the right number of heads of service. When I became the portfolio holder, having 2 heads of service in the adult social care division compared to 7 in place was completely unacceptable. I don't want to revisit how that happened. It was a huge mistake. But putting the heads of service in there, we've been able to improve management accountability, and that's really important, not just when things go wrong, but on the day-to-day running of the division. So it's been a year of hard work and change, and I'm very grateful for everyone that's been involved. And I'm really pleased with David coming into post that he's building on that prevention agenda so that we see staff in public health and staff in adult social care working together much more closely, because if we can, the more that we can make the prevention agenda real, the more likely we are to get to grips with the challenges and demands that we've got in adult social care, because we can keep people independent for longer. And with that, I'll be pleased to hear your questions.
Thank you, Councillor Murray. Members. Councillor Wildy.
Sorry, good evening, Councillor Murray. Your report is very positive, but do you think that's realistic, especially in the light of the recent CQC?
Yes, I think it's entirely realistic, and it's based on facts. The CQC requires improvement, as you all know, Councillor Wildy, and thank you for the positive comments that you made in the media, because I think that showed staff that they've got support across the council for the efforts that they have made. We were only 4 percentage points away from good, and to come from what would almost certainly have been inadequate without change and investment, I think the staff have actually done a fantastic job. I'm not saying there isn't a long way to go. I would always want our services to be good or preferably outstanding, but I'm realistic about where they are. The report is positive because so much has happened on that journey, and I think it really has been transformational. At the time the CQC came, and remember, they came in March, so the actual inspection started. We had people waiting for assessments for an average of 181 days. That's down to 0 now. That had happened not just because the CQC came, but because we were determined to make a difference, and we'll continue to do that. If there wasn't a reason to be positive, I would be honest with you, but as things stand at the moment, all of the signs are, and not just from the CQC, but from Partners in Care, because we've had close analysis from them, from our assurance report that we've also had, the signs are that we know ourselves well and we're going in the right direction. And as I say, I'm grateful for your support. That doesn't mean we can take our foot off the gas. Absolutely we can't. And the new structure goes live on the 1st of March. I'll be looking to see how that's going, and if if the momentum slows, then I'll be working with Jackie and everybody else to make sure that we pick up the pace again. But just giving you an example, for a whole year, it hadn't been possible to recruit a social worker because the reputation of the council, the level of workload that people had was well known. In the last few months, we've recruited 7 to new posts. Now, that's not where we need to be either, because we've got a 38% vacancy rate being filled by locums, but it's a change, and I hope that that change will continue.
Thank you. If I can just comment on that answer, I do think when we do generally employ social workers, they are a little bit like buses. They do come along more than 1 or 2 at a time. They do tend to come 5s or 6s, and then we do lose them over time, which is, you know, we hope to keep some of them, and I hope we keep all 7 this time. That will be great. And as you say, I hope we get to, you know, employ the other 38 that we need. But that's not a question, that was a comment.
Thank you. And just responding to that, I'm not sure where that idea that people sort of come along in groups of 7, you might be thinking about the newly qualified group of social workers that we had last year. There were 7 of them, and that number is about the same number because people do their training with us, and obviously we offer them posts. I'm talking about posts that had been vacant for a long time. So, and it's not 38 vacancies, it's 38% vacancies, but those vacancies are being filled by locums. And one of the trends that we're seeing that is a real trend is that people who've been locums, coming from agencies for long periods of time, in fact, when I took over, as long as 6 years, which obviously that is not acceptable. And I'll just come to that in a minute. It is because they feel confident that they'll have a future in Medway. And, you know, if someone's an agency worker for 6 years, after 4 years, they accrue employment rights. But we had a situation where people didn't want the employment rights. They were stopping at the agency, waiting a few months and coming back again. Largely, we're not seeing that anymore. And for your comfort, one of the things that because I meet the newly qualified social workers and social work apprentices, which is a great scheme, by the way. In fact, the apprentices I met recently, one of them was 55, showing that people, you know, change career a lot more than they used to in that lifetime. One of the things that was said to me very often by all of them is that they like it in Medway. They've frequently come from London, frequently will be a bit older than other graduates, so probably in their late 20s, early 30s, and have families. And they feel safe here and like our schools. So actually, packaging the offer that Medway can give to people to come and work here, I think that's got to be part of our recruitment strategy, because when I get feedback like that, I want to build on it.
Are you happy for me to carry
If
on?
you want to hold a question for a moment, Councillor, I'll go to some other members and then come back to you.
Yeah, fine.
Councillor Printer.
Thank you. Thank you for the report, Councillor Murray. My question is really around, obviously, hospitals are at breaking point at the moment, and I feel some sympathy, lots of sympathy actually, with the Medway adult social team. Because at the moment, the hospital are just tick boxing. If you tick all your vitals are all lovely, the fact that you're laying in a bed in a quivering wreck with no mobility and can't sustain yourself are then putting you back into the community. So as a large question really, do we have a strategic plan going forward of how we connect with the hospitals, with an adult social plan, how we can provide through social care providers going forward, how we could connect them dots, because at the moment it's obviously a system that's broken. Thank you.
Thank you, Mark, and I know you've got some personal family experience with that situation at the moment, and that will be true of many people in Medway. And look, I'm the first person, along with Wes Streeting himself, to say that the situation is untenable and unacceptable. Wes Streeting has spoken of feeling ashamed about the way that people are having to be treated, because that legacy of austerity in the context of high demand is still biting, and we've had this flu epidemic this year that has really made a difference. And just as an aside, one of the things I definitely intend to do, and I've been talking to the public health team about that through the Health and Wellbeing Board, got to prioritise people having vaccinations. We are an under-vaccinated population in Medway, particularly among ethnic minority populations, but among older people as well. You know, the vaccinations are there, they are free, they're readily available, but it's quite clear we've got to do more. That's one element of it. Our team are at the door. They're part of the multidisciplinary discharge team. I've got Kindy working at the hospital as well, so that if people need technological aids at home to help them, they are available. But Jackie has a meeting every day at 11 o'clock, and on that meeting, there are normally 20-25 people from Medway being discharged from hospital, and we very often haven't got places for them to go. We do well on home care packages. We don't have a problem with that. But in terms of residential and nursing places, we just haven't got enough, which is why later you'll be discussing my plans for Care for Medway about building our own facilities, because we've got to change things. But in the meantime, I'm as convinced as I can be, and Jackie may want to add something to this, that we are giving the hospital as much support as possible. And actually, very often, we've noticed drilling into the numbers of people waiting to come out. The reasons that they're waiting to come out are silly reasons. The transport didn't turn up. The medication wasn't ready. Now, that's on the hospital, I'm afraid, and Councillor MacDonald and I are planning to see the Chief Executive soon, because those kinds of things need sorting out really quickly if that's what's holding people in hospital. The other group of people who are pretty difficult to move, and that's having a knock-on effect to who's in the corridor, are people who are homeless. Because they come into hospital often in a very bad state and just haven't got anywhere to go to be discharged. So in the longer term, and we've talked about this with the ICB and colleagues in Kent, we need to get a facility, I think, where people who have been homeless and are ready to leave hospital can go for a period of time to be re-enabled, and hopefully to work with them to change their lifestyle and the things that have happened to them. So, you know, I'm afraid there's more than one problem, Mark. Absolutely, you're right to ask. So when you say, have we got a strategic plan, I think everything we do is pretty well geared to trying to support the hospital, but the demand is overcoming us as well, and we're not able to move as quickly as we would like to.
Yeah, thank you. I totally appreciate that, and I totally accept your of the austerity. Many years ago, before austerity, there were places like Bart's, before it was sold off for housing, that had wards that was not a hospital, was a rehabilitation with physiotherapists working on a ward, rehabilitating people with mobility and getting back into society, being back into their homes, and probably with less of a care package. So it's actually probably going longer down the road, actually more of a saving. So I do appreciate that. Thank you very much.
Thank you, Councillor.
Jackie, if you wanted to add anything to... No, we've covered.
Councillor Cook.
Thank you very much. Again, really positive. There's so much in there that, you know, we always say the real pleasure of these committees is then knowing that this is making a real difference. And I think, you know, we've had the NHS health checks in my workplace. It's made a real difference every day to people's lives. Again, sitting on a number of committees, we've spoken about, for example, drugs. I know we've spoken about here and in Regen, seeing the work there, incredibly positive. I had two questions, if that's okay, Chair, a kind of shorter one and a longer one. The shorter one was just a question on 4.5.1.3, bottom top of page 21, about the increase in safeguarding concerns. And I'm assuming that's related to what Jackie's just shared with us around the right sizing and the increased capacity in the team. But I just wanted to flag that increase there, that safeguarding concerns have risen, and why is that, and what are we doing with that? And then secondly, just a more kind of larger question around research. I was really encouraged by the research projects, the research funding. It seems like such an important thing to be doing. It feels like so much of what we've been talking about has been about right-sizing, firefighting, solving some of what we've kind of inherited. this felt like a real steer of positivity towards new and exciting things for the future. So perhaps a little bit more on that, and how do we balance the reality of time for research and bids alongside the kind of real pressures that you've spoken about already. Thank you, Councillor Murray.
Thank you for the questions, Esther. Look, on safeguarding, in 23-24, we had 2,730 concerns raised. 25% of those went to inquiry. That's 690 inquiries. And already, up to October last year, we have had 1,854. Now, I think there's a number of reasons. One of the reasons is that we have raised the profile of safeguarding, and I was out before Christmas with the teams who went to all the shopping centres in Adult Safeguarding Week, giving people materials about how to report somebody you're worried about. There have been rises in different kinds of categories of safeguarding, and one of those is financial abuse, actually. And very often, that's extremely difficult because it will frequently be a member of the family who is financially abusing somebody who's in receipt of funds for care. Now, those who report safeguarding are brave, because if you're in that situation, that can be very difficult. And sometimes people think twice about reporting a safeguarding concern because they don't want to, a neighbour to feel like they're interfering or whatever it is. And remember, when a safeguarding concern is raised, we have to have the consent of the person about whom the concern has been raised to actually investigate further. So it's quite a complicated process, but a very worthy one. So I think that there's different kinds of abuse happening. We are more open to encouraging people to report those concerns. What we've been less good at, and the CQC picked this up, is coming back to the person who raised the safeguarding concern. And that ties in with the question that you asked before about communication. And Douglas, your idea of utilising ICT and different platforms as much as possible, we're very alive to that, and we've been speaking to the Medway 2.0 team. Ideally, I would like to have a portal where people can go in easily and have a look at where their concern has got up to and what happens. But in the meantime, and as part of the right sizing, we're restoring back office posts that were taken away in the reorganisation of 2017 to 2019. And that means that social workers and occupational therapists will have more support to do those kinds of things, because that, I think, as Jackie was saying, there's no substitute actually for a friendly human voice. And I think if someone's, screwed up the courage to come forward with a safeguarding concern, absolutely they deserve us to come back to them. On the question of research, we're very lucky to have the Health Determinants Research Collaboration, and led by David Whiting and the public health team, we're trying to inculcate communities of research actually in the council, because I think that does amount to career enrichment. And for adult social care, in the situation where they've been so short-staffed, there just hasn't been the space for people to do the learning and development that they deserve to do. With 80 new staff, hopefully, that will create the space. And you're absolutely right. We need to be alive to all of the new developments that are happening. We need to make sure that our staff can avail themselves of those, and that we give them the time and space to get involved. But until the restructure is in place and all of the staff are employed, I think we're still a little way from that. But nevertheless, absolutely, when I've met the whole division, there's a lot of enthusiasm for wanting to develop more. And of course, that's the way to retain people if they feel that their career can be enriched here and that there's more going on. So absolutely, you're right about that, and I'm pleased that you've picked it up. And that's a priority for me. Coming from an education background like yourself, I know how much learning can really make a difference to people.
Thank you, Councillor Cook. Councillor Mandarakis, please.
So Esther's question was my main question, so we've covered that, but I did have two smaller ones. One was to say that the man in the case study in the Shared Lives report, I know him through something else, and the marked difference in how much independence he's showing, like the report doesn't do it justice, it is a real life change for him. So that was great. And then there was talking there around Imago and the support that they're now offering. I wonder, because I think we have a lot of people who don't quite meet the threshold for adult social care, but they do need someone who can check in and just make sure they're keeping up with their bills and keeping up with sort of adult life, like as they move to independence. Don't know if that's something that Imago can offer, but that was one question. And then my other was around focusing on the most deprived areas. So how, I'm assuming that focus, they'll be identified through the indices of deprivation, but I wondered how the work will be targeted, because within those wards, they won't all have the same deprivation, it won't have impacted in the same way. So I just wondered if you could talk about how they're targeted. I also just want to say I really love the Hopeful Project. I think that's a great initiative.
Right, so three really important questions there. First of all, look, I can't thank everybody involved in Shared Lives enough. It's a wonderful, generous thing to do. It enriches the lives of those who get involved, and it's really nice to hear that you've got a personal example of someone who has made a difference. And yes, there's lots of people and at lots of stages in their life who are just below that threshold for needing care, but they do need guidance and support to kind of move on a bit and improve things. And Imago, among other organisations from the voluntary sector, we absolutely do rely on them, and I think we can do more. And a group of people who particularly deserve to have more support are those people who have needed care for the whole of their lives but are moving into adulthood, and obviously, like anybody else, just because they need care, that they've got a right to embrace adulthood and fulfil their potential. And again, it's an area where I think nationally, actually, and particularly locally, there's more that we can do. And talking to Imago and the voluntary sector about that, I think, will be something that I'll prioritise. I try to go somewhere every week when I've got the time within the voluntary sector to have a look at the people we commission and the things that are going on. And I've seen some great things, you know. I've seen people laughing, crying, singing, digging, cooking together. You know, there's a whole lot of stuff going on. But one of the things that is frequently said to me is it's hard to get people here. So there's an issue about transport. And then when people do get there, retaining them and making them feel that they can keep coming it is another little bit of a struggle. So we've got a huge variety of things on offer, perhaps not being fully utilised, again, for more prosaic reasons that we ought to be able to work on. So that's really important as well. Okay, thank you, Leah.
Thank you very much. Councillor Hine, please.
Thank you, Chair, and good evening, Councillor Murray. Thanks very much for your report, which I have read thoroughly. And the first thing that I wanted to discuss was something that's actually not in the report, and I'm very surprised to see that it's not, is the winter fuel allowance and the impact it is likely to have on Medway people. I know that when the changes were announced, many of your Labour colleagues, it wouldn't have sat very well with them. And I'm just quite interested to hear about your views of the changes and how you see them impacting the Medway's older population.
Thank you for your
Councillor
question.
Murray, can I just... It's just a quick one, Councillor Hine. I'm just going to draw in here a moment. I want to concentrate on health and social care today. You know, there are parts of, and I know you're happy to do a quick response, Councillor Murray, but I've made it very clear to our committee many times, there's elements of the winter fuel, and we've had a members item here just last meeting, that tap onto our benefits and business support and etc. I don't want to, if it's okay, I mean, you can quickly respond, but if, Councillor Hine, if it's okay, I'm not going to concentrate on something that's not within the remit of this. You can come back to me if you want.
Thank you, Chair. I do appreciate that, but given that that support for older people is within Councillor Murray's portfolio, I do think it's important that we ask her about this.
And I do take that. That's why we answered the members' thing. But just very briefly, Councillor Murray.
Yeah, thanks, Councillor MacDonald, for that clarification. Councillor Hine, yes, thanks for your question. Of course, there are people who come within my portfolio who have been impacted by that in one way or another. I'm in no doubt why the decision had to be made. The shocking state of the finances left by the outgoing government has made some tough decisions, and that was one that wasn't welcome to anybody, but one that was necessary if we're ever going to rebalance. And of course, there's been a lot of rubbish talked about it. Everybody's lost it. That isn't true at all, as you know yourself. People on pension credit retained it, and other people as well. Locally, I'm pleased to say, working closely with Councillor Maple with his portfolio, and in particular with the Welfare and Benefits team, who we were pleased to recognise with a Making a Difference award because they've worked so hard on this. When it first happened, I wrote to, we estimated there were probably about 4,000 people in Medway who might be entitled to be on pension credit and therefore retain the winter fuel allowance. And we identified them because they are in receipt of other benefits like attendance allowance or housing benefit, but hadn't yet claimed pension credit. And a lot of people came forward. We had a big event in the Pentagon, and the Welfare and Benefits team have been out in the community, going around to different places and continue to do that. So we've had a very good response. And actually, I'll share with you a really nice email I received today from somebody who lives in Estelle Close in my ward, who I'd spoken to when I was out canvassing, actually, and he had had a bit of a moan about the winter fuel allowance. But I was able to suggest to him that I thought he was probably entitled to attendance allowance. He's got it, and he wrote to thank us. And actually, Councillor Maple and I have received lots of thank you cards because we also sent from the Household Support Fund £200 to another group of people, and we sent it directly to them who we identified as likely to being in need by the same route. So I think we've done everything we can to mitigate it. It's something that I wish hadn't happened, but something that I understand and do support in the wider long-term interests of our whole economy and actually people. And to have a rise in people claiming pension credit, I think that's a welcome unintended consequence.
Councillor Owen.
Thank you, Councillor Murray. And just my second question, if I may, Chair, was just around the use of AI in health and social care. Over the last couple of weeks, the national government has made quite a few statements about emphasising and making good use of AI, being a world leader in using AI in health services. So I'd quite like to know what your vision is for AI in Medway to help with the problems or the challenges that we have in adult social care.
Well, we're all over it, Councillor Hine, and actually I'm pleased to say that one of the applications that we use already, Magic Notes, was mentioned right across the media. That's an application whereby when social workers go out to do an assessment, the assessment is recorded so that they don't have to make notes, and the recording uses the AI application to produce the report. Now, that doesn't mean that people haven't got to read it, or indeed that it doesn't go back to the person about whom the report has been written to get their approval. Those things have to happen. But it's an application of AI that actually makes a more qualitative exchange, because, like you and I are looking at each other now, when our social workers are able to do that, and so for that matter are our people doing financial assessments, which makes it a more qualitative kind of human interaction than if you're bending down at the computer or always making notes. That's one example. Kindy are doing really well with building up applications. It's a fast-moving area. And you have probably heard me say before, but the local training centre at Mid-Kent College is due to open soon. Our Kent colleges have worked with Policy Connect to get a project for a virtual room, which is a training facility for social workers and occupational therapists and other people, about being able to go into the virtual room and see how all the different kinds of promoting independence, AI-led aids can work, practice using them, and feel more confident about putting them into care packages. So that's coming. The room in Canterbury at East Kent College is already open. And when the one in Mid Kent College opens, we'll be able to send some of our staff there. And we're hoping actually that some of the staff in adult social care will become ambassadors and even do a qualification in assistive technology. So that's all part of that kind of AI framework. And I guess we have to remember, you know, AI is a bit of a renaming of things that already existed, actually. But it is moving quickly. But one thing that it won't ever do is replace the lovely human caring faces of our staff. Hopefully it will make their jobs easier too. So my vision is that our staff will have tools at their disposal which makes their job easier, cuts down on the mundane tasks and improves the kind of qualitative one-to-one exchanges that they have with the people they're working with.
Thank you, Councillor Hine. Councillor Hamadishe.
Thank you very much, Councillor Murray, for your report and all the hard work of the team. 3 points away from good for the CQC, based upon where we are coming from, is no mean feat at all. So I think it's important, before I ask my question, to openly share the scene. We're talking about the Green Paper that was delayed from 2017 from the Conservatives for addressing social care. It never came to fruition at all. So you're coming with, literally to the table with your hands behind your back. Lots of agency staff employed, leaving, that disparity between permanent and agency staff, all of that kind of stuff going on. And to turn it around 3 points from away from being good is commendable. So my question is to do with the action plan as regards to staff retention. And I'm so pleased to hear that we're getting more staff involved. But one of the key issues that we have is training for staff, and that disparity between how we train, say, agency staff around, say, moving and handling. We're talking about as it relates to home care, domiciliary care, those types of environments. On the action plan, it's noted that we've got to take a look at various ongoing ways of improving the way we deliver those mandatory training. Can you share a bit about that?
Councillor Hamadishe, it's just, it's a really, really good question. I'm just don't want to move on to the CQC report because it's an agenda item coming up, rather than blurring it. But I mean, you can comment on it, but I'm just trying to, because that question can come in a couple of items' time. Is that okay?
Sure,
so we don't repeat ourselves. That's great.
Yeah, thank you, and thanks, Douglas. And I know that all the colleagues will be really grateful for your support. So it's 4 points away, actually. I'd like it to be 3, but it is 4. But I'm convinced that we'll get there. On the general issue of training, obviously you have to remember that the staff that provide domiciliary care don't work directly for Medway. We commission their agencies that they work for to provide the care. So every month, our team, led by Liam Bothrone, meets providers, and it's always well attended, and I attend as well. So I think I've probably attended 8 out of 12 in the last year. We normally get at least 50 people on the call. It's done on Teams. But through that, there's always a training session. So the last one I attended, we had preparation for winter, for example, and infection control associated with winter. So through that forum, the providers that we work for, we offer them training, and we do training with them, and they're open to being able to ask for training. Now, I think absolutely we can always do more, and those day-to-day things, because new carers are coming into the market all the time, like moving and handling and so on, are really important. We also rely on our colleagues at Mediquip, who provide the aids and adaptations in people's homes, that they do training as well, because there's pieces of equipment now, for example, that enable us to have one carer attend to a person with the support of additional equipment rather than 2. And that means that we're likely to get the care quicker and obviously try to, manage the costs more effectively. So something that we need to do more of. And I think when we've got the new structure in and we've stabilised the staff, then we'll put in a new learning and development programme and offer that to people. But in the meantime, and particularly for our providers, I think we're pretty good at offering them training. And I was a bit surprised, I have to say, in the CQC report, when one provider that was spoken to said they don't get much from Medway, because as far as I'm concerned, they do, but we'll go back to them and find out why they think that. You know, maybe they don't like coming to a Teams meeting, maybe they'd like us to do something in a different location, maybe they'd like packages available. I'd definitely be open to finding out what they'd want. And on the issue of training more generally, as you all know from the work that you do, having a range of different platforms, including face-to-face, is really important these days, and sort of making sure that if there's a type of training available, there's more than one way to access it for people.
Councillor Abdishay, hold that really good question, and I've put you very first on the list for that when we get to the CQC. So you're first up, don't worry. Councillor Nain.
Thank you, Councillor Murray, for your well-prepared report. The report shows a lot of positive measures being put in place to support and improve adult social care in Medway, such as the shared living, which I was quite impressed with it. On paper, it seems great, but my question is, how do we pass on this information to members of the general public who may need those services? Because sometimes on paper, it will be very good, but whether people do get information or do get access to that service will also be another thing. So it's not just being on paper and we will say, okay, this and that is going on, but do we really get the people who are supposed to have access to that service? Thank you.
Yeah, thanks, Councillor Nang, and that's a really good question, because I want people to be asking questions about adult social care before they need it, actually. And I want people to be planning that into their life plan. So I think there's a lot more we could do with other partners that we work for example, housing providers, to make sure that they tell their tenants what's available for when people need it. I've just explained to you how we work with care providers who know what services that we've got. But on a day-to-day basis, apart from the website, there hasn't been the same attention to adult social care by the Council's communication team as there has been to other functions of the Council. And I think if the communications team were here, they would definitely say they're very aware of that and they want to do more. And actually, having the CQC report has helped us because Jackie and I had an extended opportunity to talk to a number of people from the broadcast and paper media about adult social care. You know, it's a subject that affects almost every single family, but not one that people talk about very much. So creating different forums for that conversation to happen, I think is really important, and we'll be looking at that more as time goes on, particularly if we can get a portal for information. In the meantime, you'll see the quality account tonight. We do, advertise our services when there are special weeks, like I said about the Adults Safeguarding Week. Our teams will respond and we'll do special events and go out into the community. But yes, I think if I asked 10 people randomly in the street, what do they know about adult social care in Medway, probably only 2 of them would say that they knew anything at all. In part, of course, it's because people hope they'll never need it. But it's about looking in a positive way about the life cycle. And, but for the grace go all of us, Councillor Nang, if we fall off a ladder tomorrow and find that we can't work anymore, you can need adult social care at any stage in your life, and some of it's quite unexpected. So it's an area where we can do better, and I think that now we're getting into the position we want about the actual delivery. We've got a bit more space to concentrate on thinking about how we're going to get those messages out.
Thank you, Councillor Murray.
And of course, just one more thing, if I may, Chair, and you can be a great ambassador for it, telling people in your ward, putting it in your newsletters, letting them know how great it is.
Thank you. I've got Councillor Jackson, Councillor Campbell, Councillor Gilbourne, and then I'm going to finish with Councillor Wiley. So if we can keep the questions very tight, that'd be really good, please. Thank you. Councillor Jackson.
I'll be very tight. Thanks, Chair. I just wanted to say it's a brilliant report, but you can see yours and Jackie's passion coming through the report and your overall thinking, you know, thinking outside the box and looking at different creative ways. So amazing. I'm just going to the bit about short breaks, which is an amazing service and good. I just wondered, at children's scrutiny the other day, it came up that there was a wait to access the short breaks, and I just wondered if adult short breaks had a waiting list for them, or we're dealing with it. And then my second thing, and you wouldn't want me to not say this, as we work through the report and we go to the bump section club, it still doesn't say on there about alcohol risks while pregnant, and you know I wouldn't have. Until I see it in writing, I'm going to keep going, and that's it. That's me.
No, I mean, working backwards, Sharon, I know you are a fantastic advocate for the importance of fetal alcohol syndrome, and I think, I'm sure colleagues in public health will have something to say about that. We really need to, you know, it's something that we need to emphasise, and something that isn't moving fast enough for my liking. And has your questions reminded me that I didn't answer the end of Leah's question about wards with greater deprivation. That through our local health and wellbeing strategy, we're very focused on that, Leah, in terms of health inequality. And the Health and Wellbeing Board are looking at a different element of that every time we meet. So I'm hoping that that will really improve our focus. And similarly, with the prevention agenda, we're using the very, very rich sources of data in public health to make sure that we target places that need it most. So you'll have seen yourself, perhaps from the Sunlight Centre, you know, we've got exercise classes going on, trying to put healthy walks supported by our public health team into the areas that need them most, and our cookery classes. And on Tuesday at Cabinet, we talked about the food strategy and the way that we're doing that. So there are a range of, you know, health inequalities for me is perhaps the most important thing that we do. So on short break, Sharon, Carers First obviously are the people that we commission to support carers with all of the things that are available to them. And I was pleased to go to their event that they held in the Corn Exchange and found out things that I didn't know, such as there being the ability for carers to have a free break in a hotel for 2 nights, and a mobile phone with a free SIM card to keep them connected. And I think we can do a lot more. We know there's about 20,000 carers in Medway. We only interact with about 1,500 of them. So our reach needs to extend in any way we can. And you know, we're open to ideas about how we can do that. But on the waiting for short breaks, Jackie, if I ask you to answer that, please.
Absolutely. So with regard to the report, we talk about Berlin Avenue, which is our own in-house provision. There were no waiting lists at all. But I think I need to be open. There are people waiting for respite breaks, which is a similar thing. And there's about 13 people at the moment waiting for respite.
Thank you very much. Councillor Campbell.
Thank you, Chair. I'll be very brief because pretty much everything I wanted to ask has been covered by my colleagues. I just want to start by saying that it's evident to me that you have an excellent grasp of your brief. It's evident to me that you know every bit of your brief and what's happening. And actually, although the system is overburdened, imperfect, broken in parts, which does let people down, listening to you and Jackie, it's very clear that you are doing everything you can to fix it at your end. And you are keeping your eyes on all the right things and pushing all the correct levers. So that's really positive. And it gives me hope. I just wanted to say that in the section about the Health and Wellbeing Board, you mentioned that along with the board, you are also focused on improving outcomes for women's health, but there isn't much detail about that. It's something that I care about quite passionately. If you could just give us a little bit more information about what your plans are, that would be great. Thank you.
Thank you for your kind words. Jackie and I are thinking of subbing ourselves out, actually. We're shaping up to be an excellent double act. You're not the first person to have said that. But look, if I take my eye off the ball, or if Jackie does, we're not doing our jobs. That's the bottom line. And this has been an area of challenge. But I do feel very lucky to be working with a group of people who have responded so positively to what is a big ask. You know, we're all a work in progress. And the teams have been a work in progress under circumstances that made it difficult to keep their heads above water, but they've risen to the challenge, and the recent restructuring was an example of that. You know, people were, again, very positive, coming forward with their ideas, but I hope that's because they think that they're going to be listened to. On women's health, yes, we did have a special item at the Health and Wellbeing Board because of the intention by the NHS to have women's hubs in every area. There is no question at all. And in fairness, under the last government, the call for evidence happened, and we did respond to the call for evidence. There's no doubt that the conditions that affect women particularly are underrepresented in the health service, and there is a huge amount of evidence to suggest that women, for some aspects of their health, are not taking as seriously as they should be when they come forward. So in that discussion, it focused on how we were going to have the health hub for Medway, which is not in a single physical location and is still developing. And I will return to that through the Health and Wellbeing Board for an update, because I'm not entirely satisfied that Medway's got a fair share either of the funding that was available or indeed the focus from the health service on that. But where we did have some positive results, and at the Health and Wellbeing Board, you know, I will always try to invite people from different parts of the community who I think can benefit from giving us their perspective or hearing about something that they wouldn't otherwise hear about if we didn't give them an invitation. And at the Health and Wellbeing Board, when we looked at women's health services, I invited people, for example, from domestic abuse organisations in the community and from other parts of the sort of health family that look after women's health. And as a result of that, we saw that long-term contraception access was a real problem. So we went along to Clover Street, and we had a meeting with the LMC, so the local version of the GMC for doctors, to think about their perspective, and the people that work at Clover Street. And we found that actually there is discrimination around age as far as that contraception is concerned, that there are too many tariffs, making it difficult for providers to navigate, and that means that some people pull away from actually offering that service. And we had a meeting that sort of put those things together, reported back to the ICB about what we want them to do, and we're yet to hear how they have actually responded to those concerns. So that's one example. The other example is menopause services. We've been very underprovided for in terms of menopause specialist services. We have got a consultant at Medway. There have been a couple of really good events. In fact, I attended one about this time, probably in about February last year, at Lordswood Leisure Centre, 200 women in the room, with 180 of them saying that they'd had a poor service for menopause and for the perimenopausal period. And some really good voluntary sector provision has sprung up with menopause cafes. We're a menopause-friendly workplace now, and we have a cafe for our workforce at Gun Wharf. But there's a long way to go, and the overwhelming impression that I have got is that when women want menopause services, they have to go along and fight for them. And they are often given the sort of brush off and told, well, you know, it's just... Of course, it's part of the natural cycle of life, but it's a profound change for women, and they need they need supporting through that. So I wouldn't say that we're in a position where I'm really happy with women's health services. I think there is more work to do, but locally we have made a start.
Yep.
It is so moving to hear such a candid response about women's health issues. I personally feel quite moved. It was honest, but also just to hear in these chambers menopause and contraception issues being addressed and discussed and the focus you're giving. So I'm really grateful. Thank you.
Thank you, Councillor. Councillor Gilwan.
Thank you, Chair. Thank you, Councillor Murray, for your report. It's really good reading, and obviously it is encouraging to hear what's been happening. My question, though, was about where you talk about working in partnership with lots of different services, including the voluntary sector, and you mentioned a few times about the voluntary sector and the help that they give. But I know nationally it's a problem about getting volunteers at the moment, and I'm involved with quite a few voluntary organisations, and it's always a problem getting new volunteers. And I just wonder whether you found that in your interactions with those that help within this sector.
Thank you for your question, and thank you. I'm pleased to hear that you get involved with the voluntary sector. And yes, it is a problem. This year, MVA focused on volunteering for their AGM, and actually we had a really good presentation from Jill Farger, who you probably know is the High Sheriff of Kent, and she's a retired GP, and she spoke about the importance of volunteering and the fact that she herself is a volunteer, and she was very passionate about how much she got out of it. I think a few things have happened. It definitely, volunteering was very badly impacted by COVID, and although we're 5 years down the line now, which seems incredible, doesn't it, when you reflect on that, the fact that lots of volunteers who will tend to be older people came out of what they were doing, many of them have never come back, and that's a real shame, perhaps because their own circumstances have changed, but perhaps because that COVID made them more fearful of the exposure. And I think we have to do what we can to restore confidence. So events like that was a good thing. I think we have to do as much as we can as ambassadors for volunteering. I mean, and some of our organisations that we commission, Home Start being one of them, who work with families, they're really good at advertising for volunteers. You know, they're on lots of platforms like Facebook and WhatsApp and being really sort of encouraging to volunteers. And I have to say, men could do more volunteering. You know, there is by far the greatest number of volunteers are women, and yet for someone like Home Start, who often haven't got a positive male role model in their life for the families that we're working with, having a man who could come along and work with Home Start to encourage some of these challenged families would be really good. So I think there's some work we can do about that, and there's some work that we can do with younger people as well, you know, and I have spoken actually to our universities and to the college about the benefits of volunteering, and certainly at Mid-Kent College, when they have their Freshers Week, they always have a big volunteering stand and MVA go along, and so do our local universities, but probably not so much. They could do more, and I think for young people and perhaps for mature students coming into our area, the opportunity to volunteer alongside the course that they're doing is a really good way to get to know our community. But it is a challenge. And I think we have to be more realistic, actually, about the fact that people need a higher level of expenses paid, that things like, you know, perhaps offering volunteers a lunch can motivate them, because in challenged financial times as well, if people can work, they're probably doing that and not volunteering. So yes, you're right. That's something that we need to do more of, and certainly MVA, that's the feedback that I get from them. And when I went along to the social prescribing network's annual event, that was said to me pretty frequently, we wish we had more volunteers. All that being said, I was really pleased to go to the Kent Charity Awards, which were held at the Corn Exchange this year, and at that event, lots of volunteers were kind of spotlighted and rewarded, and really made a fuss of, including some younger volunteers, particularly those who are young carers. So I think that's another side of it. We need to do as much of that as we can to kind of celebrate the fact that volunteers, and in fact at that event, one of my neighbours, I'm sure he wouldn't mind me saying, had worked with young people for 38 years, and he got a special award. He really is too elderly now to work at the same pace, but he was absolutely thrilled to get the award, and it was lovely to look back on all of the things that he'd done. So that kind of positive story, I think, helps motivate other people. But around the room, with all you busy people, there's always room for more volunteers.
Thank you, Councillor Murray. Thank you, Councillor Gilman. Just finally, Councillor, I'm going to come back to you if you've got questions. Questions really only because we need to move on. So just questions.
Well, questions, but I did want to make a couple of comments as well. I was really, really happy to say with OIT, the friendly voice to go with the OIT, because too often it's talked about instead of the friendly voice, and especially in social work, the two do have to go together. Another comment on the fetal alcohol syndrome. Well, yourself and Dan must remember Councillor Purdy. She often brought that up and pushed for more work on that, more information. So in some ways it's sad that it still needs to be pushed, but not really for comments, but I'm sure we agree on those things. I've got a couple of questions which I think will be more for Jackie, but for you, you know very well that I disagree with the way the GP task group was ended. We've talked about the hospital, we've talked about women's well-being. All of those will be improved if we pushed the ICB to encourage more GPs into the area, as Medway should as well, Medway Council. So what are you doing on that? I know at Council you said a couple of meetings ago that 2 new GPs, or the numbers had gone up by 2, but we did lose between 24 and 27 in 2017 to 2021. So we lost over a quarter of our GPs in a very short time. The population in Medway is growing and our GPs are not growing at pace at all.
Can I just say, if you can ask the next question as well, Councillor, we did have the primary care team in the last meeting. We did ask that question there as well. So, we are asking that question. It is on the agenda. They are coming back as well, as you know, about the GPs and but we have revisited. I don't really want to concentrate and revisit with the time on that one, if we can. Do you want to give your next question, Councillor? Your next question?
That was Councillor Murray's and the Labour administration's very first.
It certainly was, and we had a very positive report at the last meeting about where we're going with that. It's going in the right direction. Do you want to ask your next question?
Of course, we all believe.
Do you want your next question, Councillor Wildy, or am I closing to the next item?
No, that's fine. Because I know you love to curtail debate. In your report about health walks and to encourage healthy living, basically, did you support the Labour initiative to support charging at Capstan Country Park and Riverside Country Park, which obviously limits the people that take up the healthy walks, etc., that goes on at those country parks?
So working backwards through your questions, on FASD, absolutely, I would always say that Wendy Purdy was a really good evangelist for trying to help that. And I think one of the last conversations I had with her when she was a councillor was that she'd listened to a lecture on it and really shared the content of that with staff and wanted to push on it. And I think through the Bump Club, through other initiatives, we need to get people to a position of healthy conception and then a healthy pregnancy and involve all the family so that people understand just how damaging alcohol can be to a fetus and what it can do to the whole life of a person who gets affected by that syndrome. And you'll remember, I'm sure, Councillor Wildey, Bill Esterson MP, who one of his own adopted children is a sufferer of fetal alcohol syndrome, and he's done a huge amount in Parliament, not just based on his own experiences, but with the FASD Association to advance the cause of that within the health service. And we continue to need to do more. On GPs, the 14 recommendations are still live. Dan's referred to the report that you've had from the ICB. I work very closely with Sukh Singh, who obviously is in charge of primary care. There is a long way to go. Medway is more challenged than other areas. In the period that you mentioned, because we had so many single-handed GPs, unusually and distinctively, who retired at the same time, that did put us on the back foot. Those bigger practices are more sustainable. I'm thrilled that we've got the new health centre coming. As you can see for yourself, it's under construction now in the Pentagon Centre, and there will be services there that people outside of that practice can access, together with the Community Diagnostic Centre that's coming and other plans that are on the table for elective surgery. I think there is an improving picture, but it's slow because demand is high. And if I just share with you, I'm sure you do this, I meet regularly with the GP practices, 2 of them, in my ward. And the last time I met with the Thorndike partners, they told me something that I was quite astounded by, and that was that demand for appointments for mental health consultations of those between the age of 20 and 45 was outstripping any condition for people over 65. That is new. That is something quite distinctive and different. So along with all the other things that GPs are coping with, they're coping with that as well. So any joint working that we can do with the Mental Health Trust to mitigate that, therapeutic opportunities that we can get people to avail themselves of before they get to a point where they need medicating, is important. So while we're trying to improve things, the landscape's changing all the time. And as Dan said, you've heard about what's happening. What I can say is, and this again is a legacy from Councillor Brake's time, we have seen the graduation of the first 3 doctors who were supported with a bursary through the Kent Medical School by Medway. We are doing that again. So there will be another 3. I have been really pleased to meet and talk to the graduates, and they've made me a little video, actually, which I'll make sure that I share with people. That is very small, but the reach and enthusiasm and support that it shows is bigger than the quantum itself. And now that the medical school is established and the first doctors have graduated, I'm very hopeful that one of our campuses can have a complete health focus and start to bring in people, practitioners of all kind. But it is slow going, and our task group actually I think was quite innovative at the time because there were not so many people talking about all the things that need to be done as they are now. And you mentioned the importance of a human voice. That technology is changing, and when Councillor Crozer spoke earlier about, well, what do you do if someone can't navigate that? I've seen some really good projects actually, one from Hounslow, where the council employed 1,000 people to go out, and I know that sounds a lot, but a lot of them were graduates, into the community, teaching people how to use things, how to use digital interactions with their GP surgery. And in fact, Councillor Jackson has had direct professional experience of doing that herself and has been able to share that with me. So that's an ambition that I hold for Medway, getting people out into communities who know what they're doing, showing other people how to use those kind of applications. The day that we say everything's perfect is a long way in the future, but in the meantime, everybody's trying.
Thank you very much, Councillor Murray. Thank you, Councillor Wildey.
Sorry,
I'm sorry, Councillor.
No, I did say I had a couple which I'll come back to, which might be better for Jackie to answer.
Okay. Are they about this report, Councillor Wildey? Or are they CQC?
Yeah.
What are they?
On this report then, if you wish.
Okay.
And I'm
Go.
sorry, you didn't answer the one about the countryside parks.
Sorry. Yes, I did support the rise in country park fees because I want the country parks to be as good as they can be. We were quite outside of the rest of Kent in terms of charges. It's an all-day charge. Yes, it's another small hardship for people who are challenged. I absolutely agree with you. But I suppose it's a choice between having a safe, good environment in the country parks or not. And I supported keeping a safe, good environment by getting some extra income in there that we can rely on. And I haven't particularly had a lot of complaints about it. In fact, the last time I went to Riverside, I was talking to some people in the car park and they said they thought it was pretty good value. But, you know, that's just an anecdote that I've shared. Again, something we'd rather not do if we hadn't had austerity, but something that we've had the courage to do because we care about the country parks. And I'm looking forward to the new one on the peninsula.
Thank you.
Councillor Waddy, you had a question for... Even that's the holding trees to account, you've got a question for Jackie, are you saying?
Well, it's either can answer, but because I only heard this today, I don't know if Councillor Murray will be aware. I heard a care service within Medway has recently been assessed as inadequate by CQC. Are we managing that and our residents that were using that service?
Okay. Microphone.
Sorry. And I didn't see anywhere else on the agenda to ask that, so...
Lovely, yeah, thank you. So Michael Hood, his team and Karen's team, quality assurance team, work really closely with our providers. Their role is to go out and support them, and when they see that there's some challenges and issues, then they will flag those and work to help them improve. But there are circumstances where actually that's out of our control, and when the CQC go in to do a review, then they will flag issues and we will work closely with them. When they are providers that are receiving care and support for, providing care and support to Medway residents, depending on the level of challenge that the CQC has found, depends on the decisions that we make about whether actually we look to move those people from that provider to a new one, or actually with the quality assurance team going in, social workers going in and they do spend a lot of time with them. We've had staff spending overnights with providers in these sorts of circumstances before. Depending on the circumstance will depend on whether we move them or not. With regard to the provider in particular, we're made aware of this long in advance before it's made public, so that we would have been working with that provider for several months. When we know that something isn't right, the team will write a paper and come to me to say, and I make a decision about whether we stop placing there or not. And in circumstances like this one, that decision was made. We also have to consider, though, sometimes it's the CQC will find that a provider is inadequate, but actually the people love being there, and so do their families. So it's a really fine balance, because you'd think that we would go in and go, right, everybody needs to move, but actually we have to consider the type of disability the person has, and actually sometimes it can be more, I'm going to use traumatic in some occasions, for them to be moved, for them other than to stay there. I must put that wraparound support in with them.
Thank you. Thank you, Chair.
Thank you, Councillor Wiley. I don't think I've ever been accused of curtailing the debate. And in that spirit, I just checked with sorry, Councillor Wiley, I just checked with Councillor Barrett. Would you like to say anything? Or Councillor Crozier, have I missed you out? In case, just in case, because I think every member around this table has spoken on this debate, bar two. So I think we've done pretty well tonight. Councillor Murray, can I just say a couple of things? Everything's been said. I'm going to say again, well done on a good but challenging year. The FIT plan, I think, was long needed, and that investment was long overdue, and well done for that. I suppose I will say about the ICB, thank you for your support on that, and I will say, in a very friendly way, Councillor Wildy and Councillor Crozier, with that support with the ICB and with a fantastic committee, we challenged well with the ICB, and I think we've come into a new direction. Any little comment on that is fine if you want to bring that in. There is a little one. I will thank the public health and the social care team on their achievements this clear. And I think what Councillor Campbell and all members have said tonight is a bit, you know, I'm not an emotional person necessarily, but when you read the achievements, it's good to see the achievements. It's good to see. And you and I know, because we sat around this table for quite a few years on the other side, when we were really wanting those things to happen, and we can now see that happening. I think that's a really good thing. For me, I suppose, is just a little bit of work, and if you're in agreement, we are supposed to scrutinise the Health and Wellbeing Board. And I know you're doing some great stuff on there, and I feel that as a committee, we don't get to see all of that. And I don't want to duplicate the work. And I wonder if you're in agreement, if Terry gets in contact with you and we have a catch-up with you, work out a way how we're going to make that, you know, the synergy, make it work more together. If that's okay with you, I just want to make sure that we're not missing some of the great work you're doing and we're not seeing it. So I want to just, if that's okay. My question around the vaccination you took, because I think we really do, public health could really do this next winter, some really good work on trying to get those people to take them flu jabs and pneumonia jabs, etc. I think we're missing there. Finally, I just want to thank you for putting social care on the map. I think Jackie would agree. I hope you would agree, Jackie. You better do. I'm sitting next to you. Something we've tried to do, even ever since I've taken chair here, is we've tried to put social care back on the map, making sure, because, you know, health takes over these agendas. We've all agreed that they do. And social care needs to be on there. You've heard from Councillor Prent and others about there is still stresses out there and there are still challenges. And the more, I want to thank you for making sure. I haven't heard ever one speech you've done where you haven't mentioned social care, so I want to thank you for that. And finally, I know I'm a very challenging, you would call me challenging, Councillor Murray, and I certainly have challenged you this last year, and we've done it in a very good way and a productive way, and we've got the results that I hope the residents deserved at the end. So thank you very much for working with us on that.
Just finally, I mean, thank you for all of that, Dan, and thank you to everybody for your questions, because they're all valid and they all show that people have taken the report seriously and taken adult social care seriously, which has been an ambition of mine, which in part I think is getting fulfilled, because, you know, we don't want Cinderella here. We want to be the kind of fairy queen, as it were, as much as possible, because it's a fantastic opportunity for Medway. You know, adult social care has got economic potential, it's got technological potential, it brings jobs, and it's part of the council service that, for those people who access it, remember and value. You know, we get complaints, we deal with them, but we get a lot of compliments too. And for some people, the people who work for adult social care, including with all of our providers, are the only people that some people who are being cared for see all day. And it's incredibly important for us to remember. And absolutely, look, on the challenge to the ICB, fantastic. They needed challenging on the recommissioning. That needs to continue. The bidding process is coming to an end, and we'll hear about that. And we want the best deal for Medway out of that. And, you know, it's something that we've been able to work together on. And absolutely, I think without the space created by HASC making that challenge, some of the things that have happened, like the possibility of a joint bid coming forward between the Kent and Medway services, wouldn't have happened. It was the fact that HASC made it possible to show that we really cared about that service and we're not prepared to kind of lay down and say, oh, well, do whatever you want then. It gave people confidence to come forward. So we will see what comes from that and won't take our eye off the ball. On the Health and Wellbeing Board, absolutely. You know, in my first year, I wanted to make sure it changed, that it didn't just remain another sort of scrutiny committee, because that's not what it's supposed to be. But absolutely, very pleased to work with Terry and colleagues in public health to make it the best that we can, and indeed to take, you know, ideas, if we share the work programme, of things that you think the Health and Wellbeing Board could look at. You know, my The character of my Health and Wellbeing Board is that I expect everybody around the table to think about what contribution they can make to making whatever we're talking about happen. And the example that I gave when Smither asked an important question about women's health was, going to that meeting with the contraceptive service and talking very directly about the way that women were feeling. So I'm open to anything that you think ought to come forward and to any way that we can do that better.
Thank you, Councillor Murray. And also, just to finish before I hand over to the Vice Chair, thank you to all the team. I know you always say that it's always about we, it's always about, but thank you to everyone that's made this year happen. I think, and the changes happen. So getting that stat you started with, 181 down to 0, we mustn't never forget that. It's something that we always got to remember because we never want to go back to that. Okay.
No, I always say people can talk about their divisions. Mine's the best one. That's
Thank you.
to keep
Vice Chair. Vice Chair, please.
I move that we note the report and thank the Deputy Leader for her attendance.
Seconded. Thank you, Councillor Brent. Agreed, members? Agreed. Thank you very much. Thank you very much, Councillor Murray. Okay, item 6B. I understand I'm going to Michael on this one. Is that correct?
Thank you, Chair, and thank you for our invite to the meeting. My name is Michael Hood. I'm the Head of Business Operations and Provider Services, and this is Karen, who has operational oversight of the direct payment service. I'm hoping between us we'll be able to answer any questions that you might have. I'm not going to go through the report verbatim, but there's just a few bits that I'd like to pick out, if I may. It's just really to reiterate that direct payments isn't a new concept. It's been around for quite some time, as it sets out in the report. And currently, the Care Act allows a local authority to make cash payments to those with eligible social care needs in the place of what's seen as more traditional services, such as the arrangement of a care agency or a regular day centre. Currently, Medway's, as of today, actually, because Karen's provided me the figures today, we're making payments to 487 service users, so those people that have the care need. And then, in addition to that, we're also making 368 payments to carers. The real benefit of direct payments is really, it's always been that it really promotes choice and control for that individual. They get to choose who provides their support at what times they want their support. With that in mind, however, it's not, we don't hand over money and say, there you go, on your merry way and do what you need to do. We have a very well-established team within Medway, our self-directed support team, that support those people in receiving those funds. And I'm sure if you read the recent CQC report, it's one of the areas that was actually commended. Along with Think Local Act Personal TLAP, our self-directed support team is seen as as best practice. And we often have other local authorities come into Medway to ask how we do it and how we support the people that we have on direct payments. So along with the team, we've also developed support services within the community that support those people that choose to. So, for example, they may choose to employ their own carers because, again, it gives them that choice and control. But along with that comes some employment responsibilities, and we've managed to develop services within the community that would support those service users with such things as the PAYE schemes. So, again, and pensions and such like, so that pressure isn't there for them to do. Along when we're making payments as a local authority, we have an obligation to audit those payments, and again we have a very well established audit process within Medway. Current year to date, we've currently drawn back £1.7 million worth of money that we spent out that hasn't been used. For me, that's always been because I'm a real big believer in that. I think those people can far better manage that money than what we can, because they're doing it on an individual basis. You know, if they don't receive a call at 10 o'clock in the morning, they phone that agency and say, I didn't get my call, I'm not paying for that. So they manage that money incredibly well. What they also tend to do as well is that they'll draw on support around them. You know, if their carer's off, rather than bringing in somebody else that they don't know, they may well use a family member, or they might use a neighbour or a friend, because it's not something that they do all of the time. It's something that those people are happy to contribute towards. Finally, I just want to just to highlight some of the performance. We do have a performance indicator within Medway of what we strive to achieve with regards to those in receipt of direct payments. It's important to mention at this point, so whilst you combine those figures, a little under 1,000 people in receipt of a payment, Our indicators only include those that are deemed cared for and not carers. But with that in mind still, so our current target is 23.5% to achieve in this year, and we're at 23.1% with obviously the remainder of the quarter to go. So we're it's about 9 away of achieving that target, which we're absolutely striving to achieve, because we have a really passionate team that believe that direct payments is absolutely the right method of support for individuals that need it. That's all that I wanted to add, unless there's anything you can do. After that, I'm happy to take questions.
Thank you, Michael. I will say again, well prepared, a very good report, so members would have read this quite thoroughly. So, any questions, members, on direct payments? Councillor Wildy.
I've just got 2 questions, really. Are the carers that receive payments, are they means tested to get, the money that they get?
So no, none of our carer services are means tested, no. So.
All right, great. And how many people do you think get direct payments and should really use a service, but then decide not to pay for that, but keep the money for something else, or simply because they don't want to spend it?
I think probably when you look at the numbers, so when you look at the totality numbers of those in receipt of a direct payment and those in receipt of a commissioned care package, so we would consider that a debt. Those that are on a traditional care managed system where we have a care package in place, the volume of debt that we would have associated with those that are on that part of their scheme would far outweigh that on a direct payment. Now, don't get me wrong, wherever we're handing over money, there's always that risk, and local authorities have always had to manage that. One of the mechanisms that we use in Medway is that we have what's known as a preloaded card. So essentially it's a bank account card that has the same facilities as that all of our bank accounts would have, that enables the local authority to upload money into. Now, what that also enables us to do is enables us to put certain restrictions on that account. So, for example, we may put restrictions that it can't be used on online gambling, it can't be used at an ATM machine. Where we see fit to do that, and in conjunction with the service user, we'll do that. So we absolutely try to put measures in place to best manage that risk. But wherever we do that, there's always that we're managing, and that's managed as part of our debt recovery process, which Karen also has operational management oversight of.
Okay, that's good to hear that you manage it. Thank you.
Thank you, Councillor. Any other members? Councillor Campbell.
So on that, do you have any debt from people that have not used their direct payments as intended at the moment, and what's the volume of that?
Absolutely, yeah. We do have debt that's associated with those in receipt of direct payments. What that exact figure is, I don't know off the top of my head, but happy to provide that separately if needs be. But just to reiterate, when you compare that with the volume of those in receipt of a more traditional service, it's really not comparable. It's quite a small amount of debt outstanding.
No, absolutely. I mean, I'm actually a great advocate of direct payment. I was just following through on that line of questioning. I'm quite reassured that if you don't know the figure, it's not worrying enough for you. So that's a good sign.
Councillor Cook.
Thank you. I mean, I particularly wanted to say that I, have loved ones that use a personal assistant, and it's life transforming. It's absolutely fantastic service, and I know that, residents really value it. So thank you so much. And, reading the report as we do as, residents of Medway, we celebrate what we're seeing. So thank you for that. I think just in terms of the challenges, I was really interested in the culture change around, if you've got a long backlog, you will prescribe the thing that you think's going to happen rather than, and I see the down to 30 days, which still feels like a little bit long, and what would we really like that to be? And then with that, the resource allocation tool, and we've talked a lot about digitalisation, use of technology, where are we with that? Seeing the impact of technology, and I think Councillor Murray mentioned, you might have one person in technology rather than 2 people. So just a little bit more around where we are around bringing in the next digital tools that we need. Thank you.
It's still early days yet, looking at the resource allocation tool. So we're looking to other local authority areas that have implemented such a thing successfully, and we'll learn from them. I think first steps are to have some demonstrations to understand how it would work for our individuals, and then work with, we do a lot of work with our clients to understand what's going to work for them best. So that was the resource allocation tool. What was the other questions? Well, with the culture change, so we have rolled out training to social work teams to support them to understand the real benefits of receiving a direct payment. We have a team of 11 coordinators, and they are truly passionate about personalisation. If I could bring them here today, they would definitely have you all signed up for a direct payment. They're so passionate. They invest their time and energy sitting with individuals to help them understand what the benefits are. So not only are we training the social workers to help them understand the value of a direct payment, so if we have signed somebody up to a commission service, we will still visit those people and, you know, share our passionate belief that the direct payment is the right option with them. We won't coerce them, we won't force them, it's entirely their decision. But through that support planning process, we are usually successful in converting them to a direct payment if it's appropriate.
Yeah, I have no doubt of it, even just hearing you talk now. Thank you. Yeah, just really curious. Again, I'm asking about staff training, as I always do. I guess the staff training is more effective the more we have a static workforce. And the more the workforce changes, the more we have to keep reiterating training with new people. So are we seeing that kind of change have an impact? Thank you.
We rolled out training to social workers over the last 3 months. We've seen the referrals coming through to the direct payments team increase. So clearly the message is getting across. We're spending more time in the office now with those social workers so that we can reassure them. Because sometimes they think, maybe I know best, maybe a commission service would be better for them because they don't have to worry. Actually, that's not your call. Let us talk to that individual and let us explain to that individual what support we can offer to help you receive and manage that direct payment.
And Mike, you got about the waiting list. Was that one of the questions? Yeah.
So we did have a waiting list. We did have issues with vacancies in the team. We've recruited to those vacancies now. We've recruited some specialist people, actually, that have sought to work for the Medway Direct Payments team. They've come from a user-led organisation. They've heard good things about Medway, and they've come to work for us. And they're a specialist in support planning. So they've got an actual qualification in support planning. So the waiting list has reduced. We have allocated all referrals now up to November. So we're sitting on the referrals that came in December, but they will be allocated next week. So the waiting list has reduced. And people talk about, I'm going to talk and talk, I could talk at you for hours, but people talk about, it takes time to set up a direct payment. Quality takes time. So we will invest our time and energy in talking to that person, understanding that person, then helping that person navigate what is out there, helping that person to think outside the box, and then ultimately, after the average days is 42 days to set up a direct payment, setting them up with the best support wraparound plan that we can together devise.
Can I just add to that, Councillor? So, Councillor, we're also, as part of, you've heard lots about the investment into social care. Part of that investment sees investment into this team as well. So, as part of the monies that we're getting for that, for this particular team, is that we're introducing greater management oversight to manage those referrals and how best we need to shift resource to ensure we bring that waiting time down. It also sees the introduction of what we're referring to as a PA resourcing officer. We found it really, so people having a PA, the feedback has always been it offers the most choice and control because it's that individual working for that person on a one-to-one basis. We have some that are shared, we do, and again, we're, as a team, we've always networking and making sure that we're making good use of the PA resource that we have, but we're bringing in a specific post to do that because what that means is when a coordinator goes out and does that piece of work with somebody, they've then not got to go through that process of recruitment. There's a bank of people waiting where we can tap into and best match somebody. So we're looking to, and again, that will drive down that waiting time because it means we've not got somebody else on the books that's waiting for support.
Just briefly, Councillor Hamdashi.
Just very quickly, that's completely fantastic. I'm a big fan of direct payments. Just want to say quickly, regarding this whole myth busting that you're doing a lot with social workers, to get them to understand the value of the direct payments, have you thought about doing some in-reach to re-educate the educators at university level so that you really get newly qualified social workers brought into the direct payments?
We did, so in a previous tranche of student social workers, we had a student social worker, instead of sitting with the locality teams and social work teams, they sat with the SDS team. And at the end of it, I think she would have come and worked for the SDS team, but she was our person that then went back to the universities and said, I think we need to do more about personalisation. I think, you know, what is going on over here is a bit different to what's going on in social work teams. So yes, I take on board your point, and it's a really good suggestion, and I will outreach to those universities and see if we can provide some training to them around personalisation and direct payments. Thank you.
Just one more scrutiny question for me, and then I can bring Councillor Murray in just to answer just a quick comment. Just my last one. Councillor Waddy, have you got one to come in? Have you got one to come in? Because I was going to end with... My one was just about the resource allocation tool again. Have we got a timeline on when we're going to have that? Because there must be, I wouldn't imagine where, you're going to tell me there probably is about 30 different models, but I bet there is, yeah, I can tell. But there must be one or two that really work and are really good that we could just get on with, surely. I mean, I'm making it sound so easy, I know, compared to what you guys do in the team, and I know you do a great job. But do we have a bit of a timeline or when we're hoping to bring that in? Because it's going to make it easier. If it's the right model, it's going to make it easier for you, right?
It absolutely is, and I think it's probably important to so the resource allocation tool forms part of the initial eligibility assessment. So despite whether you have a direct payment or not, you would still go through that resource allocation process. With regard, there are many. There are lots of that you can buy off the shelf now. I think the luxury that we now have is that lots of other local authorities have gone through those processes, tried, tested, adapted. And actually, within the next couple of weeks, we have a demonstration from a provider coming in. Yeah, I think certainly we want it in as soon as we possibly can.
Councillor Wyatt, I've got Councillor Wildy and Councillor Crozier. Nothing, Councillor Wyatt? Councillor Crozier, before I bring Councillor Murray.
Thank you, Chair, and thank you for the report. Just a little bit around the promotion of the care package. How do you go out to the public and people that need it to, so they understand that it's there to apply for?
So I think it comes back to we with regards to direct payments itself. It's on our websites. It's promoted through. We've done some social media bits. Again, it's something that we can look at, but it's really promoted as part of that assessment process because you're not eligible for a direct payment until you've had your assessment and you are social care eligible. So it's really looking at the work that Karen's doing with our social workers to really promote them in promoting the scheme for us, because it's only at the point of when you become eligible that you have access to a direct payment.
If I may, but presumably most of those people that are accessing care direct payments are elderly people and don't have access to that technology. Am I wrong in that assumption?
So I was looking at the statistics earlier today around the percentage of older people who receive direct payments, and it's 20%. The other 80% is your working age adult group. So we were talking this morning about how we can outreach to the older age group to help them understand what a direct payment is, and then just to understand from them why the uptake is low. So there will be some work done to understand why older people are not choosing direct payments and outreach to carers groups.
You said that it wasn't means tested, and I know certainly when my mother took advantage of it, she didn't realise it was means tested, and because of that, she felt that she shouldn't claim for it.
A carer's direct payment is not means tested, but if you're a working age adult or an older person who receives care, then that would be means tested.
Yeah, that was the point I was making. Older people would perhaps feel that they weren't entitled to the care and then wouldn't look for it. That's probably why your figures may be low.
Yeah, possibly.
Jackie, do you want to come in quickly?
Thank you. I think, so I just want to sort of clarify, care is care. It's delivered in different ways, so actually it isn't necessarily from an older person's perspective that they wouldn't go down the direct payment route because they might be charged, because they would be charged if they were receiving a care package. I think it's about dispelling myths. So a lot of people who have a direct payment become employees, so they employ a personal assistant, and sometimes that puts people off. But what the team offer is what's called a managed service, where actually they pay somebody to do that piece of work for them. So that's when Karen's saying about the promotion and the training and the skilling up of the social work teams, so that when they're having those conversations and somebody says, oh, I don't want a direct payment because I don't want to become an employer, that they're able to then go, well, actually, there's lots of different options and things. So I think that's the work that needs to be done to to dispel those myths. Because, you know, somebody said to me, do you want to become an employee and deal with PAYE and so on? I wouldn't want to, and I understand why potentially some older people wouldn't want to do that. But I do come back to what Mike said earlier on. You know, for some people, commissioned care is absolutely the right thing for them. They want to know that they've got a carer coming in 3 times a day, and that's why Karen says you'd never force anyone down that route. But we do hear stories where somebody will say, I want to sit out in the garden and I don't want to be wheeled out in the garden at 11 o'clock in the morning because that's the time my carer comes in. I want that choice, and that's the part that we need to change.
Thanks, Jackie. Thank you. Councillor May, do you want to just come in with a comment quickly?
It was actually reverting to my old role. It was a question, to be honest. And Jackie's touched on it there. It was about the employment status of people like personal assistants. Because I have seen from casework that someone who's a personal assistant, for example, tried to get a mortgage, and they were sort of, I mean, that wouldn't be the only reason you'd be refused a mortgage, but because the person that was paying them was effectively their employer, but the personal assistants, you know, do a tax return, don't they, and do all that kind of stuff. They were then turned down because it was deemed that, well, that wasn't, you know, stable employment and could change at any time. So I just wonder, in terms of making sure that we've got a good pool of PAs, what support we give to PAs themselves about their employment status when they're working with somebody who's paying for their service under direct payment.
Keep turning. So we not only support the direct payment employer, we support those PAs as well. So all those PAs are able to reach out. When they sign up to become a PA, they also sign up to our database, and they're signing up to regular newsletters, and they can reach out to us if they have an issue like that. It sounds like the person, the PA that you were talking about, was a self-employed PA. So we do have some PAs that are self-employed. They will enter into an arrangement with that person, and the person is contracting that PA, not directly employing them. So, yeah, in circumstances like that, they can reach out to us and we can help them. Yeah.
That seems we've got everyone in. I think so. So thank you very much. One thing I will say for members, the good thing about these type of reports, and we're so glad we got you in, because I think we've been talking about direct payments to Jackie every single meeting, is that we've got a really exciting provider training plan for HASC developing. Terry's developing that now for all members of the HASC. And where we've heard tonight many members saying that, how do we do that? How do we get into that? How can we tell our residents about that? I think it gives us really good ideas on, and I'm sure you guys wouldn't mind helping members get that message out further. So thank you very much for that. Vice Chair.
I move that we note the report.
Is that seconded? Agreed, members? Agreed. Thank you very much. Thank you very much for your time. Members, you've got 5 minutes break. 5 minutes only. Thank you. Welcome back, members, to the second part of this meeting. We're going to go straight into item 6C, and that's the item regarding our CQC assessment and assurance of local authorities. Jackie, you presenting that.
Thank you, Chair. I won't go through the report. Obviously, I know that you will read them, but there's just a couple of pertinent points that I think it's really important to flag. We've talked today about the score being 59%, which is 4 marks away from good. And Councillor Murray mentioned earlier on that we've had a really quick turnaround in a year. We would have been in a very different place a year ago. The thing that I wanted to pull out is when we met the CQC to give us some high-level feedback, and they've also referenced it in the report itself, the first thing that they said to Leanne and I was, your teams are passionate and proud to work for Medway. That was the comment that they came back with. That was the start of that. We've got work to do. We know we have work to do. The action plan on the, as an appendix is a starting point. There'll be a more detailed plan behind that we'll be delivering from an operational perspective with dates, etc., as you would expect for any sort of project plan. The plan itself was already in place. We drafted that when we did the self-assessment, and it's been added to with the outcomes of the CQC report. The thing I wanted to comment on, and we do talk about it in the report, is there were no surprises. The self-assessment demonstrated that we knew ourselves well, and we know where we need to go and what we need to do, and I'm confident that we can do that. I'll open up for any questions.
Thank you, Jackie. Members. Councillor Ahmed, sorry, no pressure, I know, but I did promise I'm going to put you first.
So, I'm sorry, Councillor Murray, this might sound like Groundhog Day in terms of the questioning, but it's just in terms of the, first and foremost, back to the training deficit that we have in terms of key skills such as moving and handling. We know that's a big issue. But also on a wider note, how are we addressing the whole EDI so that our workforce mirrors the actual client base that they serve? Just an update on those two things. Thank you.
Jackie and because it's Jackie's item, but yeah, I mean, it's up to you both.
Yeah. Okay, so, I mean, thank you. So with regard to the training around moving and handling, Councillor Murray mentioned earlier on, that's more specific to the care sector. The report is particularly around social work and the social care staff, although it does talk about the wider sector and how we're supporting them. Providers are required to carry out, to make sure that they deliver the training themselves. I talked about the quality assurance team. I'm nodding over there and they've gone. I talked about the quality assurance team earlier on. That team goes out and makes sure that the training that they do is in, that the providers are required to do is in place. And if they don't do the training, then they obviously gently hold them to account to make sure that's done. But with the my occupational therapy team also support providers as well. So the OTs are trained around moving and handling, and they will support providers. They support our partners in Medway Community Healthcare. So we look at that across the board, but specifically it is the responsibility of the care providers to ensure that the training is delivered. Sorry, and then with regard to EDI, apologies, with regard to EDI, we know that's a shortfall in Medway, not from a point of that we don't provide care and support to people from different ethnicities, but actually sometimes we find that families don't want to reach out because they're used to looking after their own community. And it sometimes gets to a point of crisis where we become involved. So what we want to look at doing is working with faith groups, with the voluntary community sector, partners to actually talk about that promotion side. We need to be really mindful that we're not saying to everybody adult social care is available for all, because we want people to be independent and around the sort of working around prevention. But actually, if people don't know about us and they need that care and support, that they'll reach that crisis point. So that work that we do is really important. As part of, we talk about the right sizing a lot, eventually that'll be, it's like when you say I've been new in post, isn't it? Where it will get to a point that that right sizing is normal, but we've been able to recruit an engagement manager who is doing specifically working with people, getting feedback and understanding what we need to do differently, and built into the medium-term financial outlook for next financial year. We've put in funds to increase her team. can't have one person doing everything for the whole of Medway, so bringing in some engagement officers, and that means we can really start reaching out to the community to focus in that area.
Councillor Murray, do you just want to add on to that?
Yeah, I mean, just a couple of things, Doug, 'cause it's an important question. One thing, obviously, for you to remember is that our providers get inspected by the CQC in their own right. So that will also pick up some of the things that you've said about training, as well as the things that I've said about the joint and shared training that we do. On EDI, it's a really important thing that you've raised. And one of the good things about the social work, particularly the social work workforce, is that it's probably the most diverse in the council, actually. And when I've been with the whole division meetings that we've had, it's been interesting to me to hear people's insights into the way that they have shared with social workers outside of the more diverse communities about having different expectations of the way that families work. And I think that's really important. But the flip side of that is, as Jackie has said, quite often those families wait until there's a crisis before they contact us. And carers in our more diverse communities are much less likely to be registered as carer and therefore less likely to get the benefits. So there is a real piece of work with people like our Diversity Forum, Rupert Sen, who's very strong on this, in making sure that all communities feel that we've got something to offer them, even if it's their preference to contain things themselves. They still need to know that they're able to do that, but we can still support them while they're actually doing that. And I think that's a message that isn't very clearly heard in the diverse communities of Medway. So, you know, any ideas that you've got about how we can make that happen more would be really helpful.
Thank you. Just a very quick comeback.
To Jackie. If you can invite... Go on.
Okay, no, just very, very quickly. Okay, sorry about that. Yeah, it's more to do with... thank you for that appraisal, because it's a two-way transactional debate that we're having around EDI. And again, the myth-busting, exactly, the myth-busting element and the promotion and understanding what both sectors, both sides of the equation need and require is so important. Yeah.
Actually, I hope you feel we'll give you a good hit this time. Councillor Wildy.
Thank you. My first question is to you, as it happens, Dan. I'm assuming we will have this come back to the committee in 6 months-ish or so. Most of my detailed questions would be how we have improved when it comes back. Two major concerns is obviously the safeguarding and addressing Section 42 backlog and whether that's improved already in this short time. And the big problem we in Medway have, which I'm sure you personally can't do anything about, and that's demographics, which are a pressure on us and will continue to get worse in the next few years. So they're my comments, but as I say, most of the report, it's, in my view, it's more important where we are in 6 months' time when we come back, and hopefully we've seen even more improvements.
Just before I hand over to Jackie, yes, definitely, and we'll make sure it's on the pre-agenda and Terry will put it on, but I see nodded from Jackie that we will be looking at where the journey as it goes along, as I think you, Jackie and Leanne and Teresa would expect us to. So 100% Jackie, do you want to comment briefly on that?
So between the time of us completing our self-assessment, where we'd I just need to be mindful, the self-assessment was what we submitted to the CQC. We already knew the areas that we were struggling with. There was a piece of work done. We got some funding to support the teams with the backlog of around the Section 42 inquiries, and they actually did an amazing job and brought those back down. Councillor Murray mentioned earlier on the rise that we've seen recently, so we have seen some creep back up, but we've got, I talked about the heads of service, so we've got a head of service responsible for safeguarding. She monitors it all the time and she flags immediately. She starts to see if there's any concerns, and an action plan is put in place with a view to bringing those back down. I think, if I'm honest, the very big difference now is that oversight keeping on top of, you know, RAG rating, prioritising, checking in with people to make sure that they're safe and okay. So it is a challenge, but we are working towards that. The restructure and the right sizing brings in some additional resource. And what I've asked the team to do today is some analysis around the numbers. There's always a bit of a debate about whether somebody sends a safeguarding referral in because they think it's a safeguard, or actually if somebody needs a Care Act assessment because they need care and support. So they're going to be doing some analysis around that to see if we need to be working with our partners and giving them a bit of training about what's the right referral to make. With regard to demographics, it is definitely a challenge. I always think of David's graph that shows the rise. And we've talked about that because we want to reduce demand. Obviously, it has a pressure financially, it has a pressure for the team. So the prevention agenda, obviously, is going to be really important for us in adult social care. But in the same vein, we talked earlier on about about AI and assistive tech. If we can support our teams to work more efficiently, then I would hope that means that we don't have to see then a dramatic rise in the number of staff. So it's trying to balance both. But just to reassure you, and I know I don't need to because Councillor Murray's been very clear, there will always be a person. There will always be a person.
Sorry, can I ask one other question that's occurred to me? Because of devolution on the horizon, we will not get, I'm assuming, a CQC between now and then on the same terms. So how can we as members have a laid out way of judging where we're going?
So we don't know when the CQC are going to come back. It could be in 2 years' time. So it could happen before local government reform. We will continue working in the way that we would do in Medway to improve. The action plan, you'll see in there, it's got key performance indicators in there. So we'll be able to demonstrate in specific areas where we are improving through those KPIs. But for me, it's not just about the KPIs, it's about the quality. So the principal social worker, again, was somebody, fantastic advocate for adult social care, but on her own. Again, we've been able to recruit what we've called practice development managers. So we now have 4 PDMs, and those 4 practice development managers are working very closely with the teams to look at auditing. Hear about that in children's services all the time. You know, what does good look like? And providing then with the looking at what training is needed to bring the level up. We have just commissioned training, what we're calling back to basics. So revisiting what strength-based practice look like, what's a Care Act assessment. And that's not because the teams don't know it, but actually sometimes you work in a certain way and you just need that refresher. And so we're going to be starting that on the 6th of February.
Thank you. Thank you.
Thank you. I think, look, from member, I think we've had it. You would expect a question from me because I was asked these. And I just want to ask a question because I think it's really important for the HAS committee members to understand. Hopefully you can answer me, Jackie. Is that where would we have been without the investment and the changes over the last few months? What would that, you wouldn't have been able to exactly give us, but me and Councillor Hamadishi we say 3 points, but you're right, you 2, 4. We like to say 3 because it's nearer for us. Where would you think we would have been without our investment and what we've done in the service so far?
So when we were told that the CQC were going to start re-inspecting adult social care, because they did previously, they stopped in 2010, I believe, after we'd received the framework and were looking through and reading it as a management team, and bearing in mind, I said there was only the 2 heads of service, but my operations managers as well. In one of the management meetings, I asked the question of each of them, where do you think we'll be if the CQC came in today? And of the majority, it was inadequate. There were some that were saying requires improvement. We asked the question why, and it was because there were waiting lists. There still are waiting lists. There's no, you know, that it is a challenge, but a lot of that was to do with the morale of the staff and how they were feeling. The investment means that from the team's point of view, that they've seen that adult social care is being taken seriously. They've seen the changes in the recruitment. that right sizing has not just been about right sizing adult social care. So adults have now got a dedicated HR business partner, dedicated finance business partner, and a dedicated an increased performance response from our performance and intelligence team. So that shift started to change as well. The principal social worker made a massive difference. The PDM made a huge. The two PDMs we had at the time made a huge difference. And so when the teams could see that things were starting to change and starting to shift, they naturally then started to work in a different way as well. If I can just add, when we had the CQC report published, we held a teams meeting with Councillor Murray. Obviously, we'd known for a while what the outcome was, and we were a bit concerned about if you're told you requires improvement, what would that mean and how would it affect the staff. Actually, the feedback that we've had has been really positive because they recognise that the requires improvement and the high requires improvement is where we are. And the feedback I've had is everybody's really excited because they say that we can change in the 2 years we need to.
Thank you, Jackie. I asked the question, just in case Councillor Wiley comes back and think it's me being political. I asked the question because I think as a HASC committee, we need to, like you did say, Councillor Hamadisha, you said, look at where we've come. And I think we shouldn't never take our eye off that ball because we have come such a long way in this last year and a bit. And I think we need to recognise that. And that little flag on that chart was very good, actually, because it's right at the very top. So it is good, and I can understand it. But we've got to recognise the amount of work that the staff and that have done to get us where we are today, because it could have been a very different picture if it would have been back, you know, in the past because of that investment again. And that's where I will say things have changed. Councillor Murray, do you want to say anything just before we finish that agenda item and we're done? It's just on the CQC.
I mean, I just think quickly it is important actually for the committee, I hope, to record their thanks to Jackie for her leadership and forbearance that she's shown through this. You know, she was as enthusiastic and as determined when things were rougher than they are now. And I think, you know, one of the things that was said to inspectors, and one of the things that the inspectors said to me, was that visibility was good. Visibility of Jackie, visibility of me was good. People knew who we are, and they could see us. And I do think, you know, as personal tribute from me, I've thanked Jackie lots of times, but doing that on the record, I think, is important because it really is a significant achievement. But it's not where we want to be. And I do remind everybody that this work has been done while the demand was continuing to pour through the door. It's not as if we could say, well, we'll stop for a few weeks, sort everything out, and come forward. You know, all of these changes have had to happen while people were doing their day job, and that in itself, I think, is a significant achievement. But it's born of people meeting in the evening, meeting in their break times, you know, really going that extra mile to get things right. And they've done that willingly because they're committed to the service and they want it to be as good as it can be too. And recognising that sort of commitment, I think it is really important. And, you know, that's why tonight, hearing that support from the committee, I know that will be important to staff as well.
I mean, I'm going to come to you, Councillor Crozier. Jackie, hopefully, will say we do give quite good compliments to Jackie during a lot of these HASC meetings over the last year because a lots have changed. We've seen the changes. All the committee members, we've seen the changes. So, but we will definitely put that on record tonight, our thanks, and we'll put it as Vice Chair. Can we make sure it's on our recommendation as the thanks to Jackie? And Councillor Crozier?
Yeah, thank you, Jackie. I said before, we can see where we've come over this period of time, and it's been over the period of time since I've been here, but I don't think I can take any credit for that. How are we, or are we, and do you think we're doing enough to tell the residents that we've come a long way? Because I don't think they're seeing that.
I think it comes back to what Councillor Murray said earlier on, which is people are really only ever interested in adult social care when they're involved with adult social care. And you know, it's been in the press. Councillor Murray did some briefings. It's been on the news and been on the radio, but it's not a big ticket item because it is only if you're involved in it. I've always said from the day I was appointed into this role that I would bang the drum for adult social care and I would bring it up a level where people are recognising it, and I feel that I'm on the way there. I'm not quite at the top yet, but I will get there. And one of the things that I've discussed with my team is about us being out in the community. So coming back to the conversation about how do we support people to receive care and support that from an ethnic background, we've not been in the position where I can ask my management team to go out into the community to have those sorts of discussions, because we just didn't have the space to do that. So for me, it will be about going out to our care providers, going to the meetings that, you know, that Councillor Murray goes to. We need to be doing all those sorts of things and saying this is adult social care. What I said earlier on, we need to be really careful that we don't set people up to thinking that everybody's entitled to it, because there is an eligibility criteria. But when you look at the numbers of people that contact us, it was last year 10,933 brand new requests. That was people that have never had any interaction with us. Just under 24% didn't need any support from us at all, and another 25 needed information, advice and guidance. Actually, I prefer it if people were coming and we were giving them information and advice and guidance than sitting out there and not knowing what to do. So that reaching into the community is really important.
Okay, thank you very much, Jackie. Vice Chair.
I move that the committee notes the rating issued by the CQC and the action plan which addresses the improvement areas identified in the assessment. I also move that the committee commends Jackie for her diligence and dedication and a commitment to improving Medway Council's social care offering.
Is that seconded? Seconded? Is that agreed, members? Agreed. Thank you. Thank you very much. Members, moving on to item where we are, item 6D, which is the Care for Medway, preliminary options to build and operate a care home. Jackie, we've read the report.
Yeah, no, thank you very much. Just to say that Sue Irving would have been here to present this today. Unfortunately, she isn't able to attend, so she's asked me to pass on her apologies. I won't go through the report, but I just wanted to give a little bit of data to give you a bit of an understanding of why we're looking into this. So obviously, from a social care perspective, we don't support everybody that's discharged from Medway Hospital. There's only a proportion of people that we do. The hospital supports people, Medway Community Health does, and we do a proportion of those. But just to give you an idea, yesterday there were 34 people waiting to come out of hospital for some form of rehabilitation or assessment. So 13 were waiting for an assessment bed and 18 were waiting for a general rehabilitation bed. And that was any time between 0 to 61 days. We call pathway 3 is when somebody's coming out of hospital into a permanent care home. So we've done everything we can to support them. And on pathway 3, this isn't all of the numbers, there were 17 people waiting to be discharged, and they'd been waiting from between 0 to 98 days. So that's people waiting in a long time in hospital. Some of the pushback that I get is care homes have vacant beds, which they do for people who pay privately, and they absolutely do. But looking at the data, there were 7 people that were self-funding, waiting to come out of care, and that ranged between 22 days and 0 days. So the whole thing around the choice and being able to choose a care home that is good, that you want to go to, is something that needs to be considered. We've also got people in what we call discharge to assess beds, so that's where they've come out of hospital funded through the ICB and then need support from adult social care. There are 17 people that are in a care home outside of Medway, funded currently by Health, that need to move into a care home, and we are really struggling to find care home beds for them. And there's 3 people in specialist rehab beds. And then we've got 9 people that are in the community, so living in their own properties that require residential or nursing care, that we're struggling to find care for. And we've got 14 people that are living in care homes, but their health needs and care needs have declined and they need to move. And again, we are really struggling to find care for them. So the paper talks about the fact that we need to do something and we need to do something differently. And we've done some preliminary work to look at what would it cost and what are the options for us to deliver a care home, and what are the costs and what the cost would be to provide the care for the individuals. And you'll see in the report that those costs are a lot greater than it would be if we were paying a care home privately. That's because we're not specialists. The people that have done the work in my team have never built a care home. They've never delivered, created a care home. And so the ask is for Cabinet, that's going to Cabinet, is that we use some money that I'd got allocated through the exceptional financial support to bring in a specialist that's worked with other local authorities to do that real deep dive analysis, working with the ICB, working with the hospitals, working with their community health partners, to present back to say, actually, we want to deliver a care home, but is this financially viable and is it good for our residents? The important thing, and Councillor Murray mentioned it earlier, is about the economic environment that brings, the financial ability to Medway. So that the expert will consider all of that. And that's what the paper is saying. It's not saying today that we're going to be building a care home. We want to do that. That is an absolute ambition for Councillor Murray, but we need to have a very detailed business case that determines how we're going to do that. The proposal for the care home, it talks about an 80-bed unit, isn't just for residential and nursing care. The proposal would be we would have 40 beds downstairs as a residential dementia nursing home and 40 beds upstairs that could flex. So it could be that we had rehab beds up there. So I was talking about those people that get stuck in hospital because there's not enough rehab beds. Supported living, another area we see is people coming out of mental health hospitals and actually not going into residential care. That's not the right thing for them. The right thing is for them to have supported living, but it can take weeks to set that up because we have to create a tenancy for them. So we would look at all options so that could potentially be step-out beds, so it frees up the hospital and people have got somewhere to stay where they're being supported before they move on to their forever home. I'll leave it there for any questions.
Question, Councillor Printer.
Thank you. I welcome this initiative, and I'd like to say just let's be brave, let's be radical. Obviously, it has to be within a financial envelope, and I totally agree with that. Just on another note, they do this across the country in all sorts of different local authorities of all different colours. This isn't some radical Marxist idea of taking out the private sector. We can work together, and I'm pleased to see that it does have that flexibility that you might not necessarily get with a care home as it is. I wish this had been taken up earlier when we had other buildings before a fire sale of buildings that have become care homes from the private sector. Just a concern is, obviously, the private sector in Medway is below the English average. If we do this, let's be the best that we can be. That's sort of a question, but yeah, I just want to support the initiative. Thank you.
Thank you, Councillor Printer. Councillor Amadishe.
Yeah, and also to support my colleague, we need to have a lot more ambition when we do an initiative like this. It's an opportunity for us to benchmark best practice. So my only 50 pence to add to that really is, can we ensure we get the best staff that we can possibly find to work in this care home if it becomes a thing, and also use it as a research bed, because there's an added value to it. If we're controlling the environment, we can also do some great research and actually sell some of the findings of that research. So it can almost self-sustain itself. And also the added value is if we are creating the benchmark for standardization of the best care provided, other care providers have to up their game. So it's a win-win-win all around.
Thank you, Councillor Amadishe. Councillor Wadi.
Thank you. Will the consultants be looking at not the best size for Medway? Obviously, we need to know how many beds we need, but the best size to run as a care home, because I'm a painter and decorator, been a contractor, spent 5 years working in care homes of all different sizes, and the ones that I went back to were often the bigger ones because the smaller ones went bust. Excuse my voice. Because it isn't simply running the number of beds, it's having the qualified staff which you need to have legally to run them. Are they available? Obviously, a bigger unit, which always amazed me, still only needed one of certain specified staff with certain qualifications. I mean, some of them were 350 beds, but you still only needed one nurse of a certain qualification. And obviously, in my view, that's not enough. So I'm not suggesting that big, but when we're looking at this, make sure that the staff are available, it's big in, or of a size enough that we can get the staff and still pay, etc., etc. And the other big cost that you can never really build in is the changes to, say, the room sizes, and all of a sudden the rooms have got to be 2 foot bigger, and you're halfway through building some. So will the consultant, obviously if they're an expert, they will be aware of all of these, but obviously there are a lot more things than I'm aware of that need to be looked at, but as long as they're looked at thoroughly, but in my experience, the size is the big thing, because the smaller ones were often flats when, you know, in the great scheme of things, I would have been going back to give them a coat of paint. They'd gone. So, yeah.
So,
there's comments.
Yeah, I know they're more, it's to note really, I mean, but if you want to just make it brief, but it's really for noting, they're good points.
Just quickly, so what we've done is we've done a bit of research, and there are companies out there that have worked with other local authorities that are specifically work on this sort of thing. The guidance is very clear about the room size. You are right, things change all the time, but what we won't be doing is going for an organisation that's never done this before, and we will be reaching out to local authorities that have used them to find out how they work.
If I come back, would we intend to use them for Alzheimer's, dementia? Because again, they're specialist and different, and they often have to be a different wing, etc. So, okay, fine, thank you.
Councillor Crozier?
Yeah, just a quick question. Are all the care homes in Medway or Kent and Medway private at the moment?
So in Kent, they own some, but the majority are private. In Medway, the short breaks centre that we spoke about earlier on Berlin Avenue is our own, but we have all others are private.
Councillor Cook?
Sorry, again, another very quick question. I'm just reading, check I haven't missed it. Is the intention that this is the first of several? So just both these questions kind of went together in my head. Or is this the intention that this is something so that we can control stopgap, the immediacy, help with the discharge from hospital, etc., and be the training centre for best practice? So what happens next after this? Thank you.
So, I mean, initially, I mean, this is going to be a long-term programme. If it goes ahead, the likelihood is we won't get a spade in the ground until winter 26. So it's not going to be a quick turnaround. So we've got a lot to do in the meantime to still continue to support our residents and to support people coming out of hospital. We've talked about actually, do we need more extra care facilities? When we started to look at this at the very beginning, it was actually a flip. So we were really struggling with providing home care. We had more than 120 people waiting for a package of care, but we didn't have any problems with beds. It's turned around now, so we don't have any issues with home care whatsoever, but we do with the beds. So we'd actually looked at, should we set up our own care provision? So in Southend, they have it's Southend Cares, and they provide home care, lots of things. But because this is the biggest need, this is the route we're going down. I think it will really depend on the outcome of the analysis to determine whether this is a one or whether this is something that we go for longer term. But what we need to think about as well, and somebody mentioned this to me today, is local government reform. Is it shouldn't stop actually if we have a bigger group of residents, then actually we're going to need to be able to provide that care and support. So we don't know. We need to see what that looks like down the line.
I suppose my comment for Councillor Murray, will just bring you at the end, is the spade in the ground is a good thing, you know, we're saying about that, but there is also, I suppose the report could also look at other options, i.e. buildings that are already there, or our housing providers maybe providing nice premises or big buildings, or, you know, anything like that. So it's an open option. It's not necessarily, although it is quite nice to design from the ground up, I think, doing it that way. Councillor Murray.
Yes, I mean, thank you, and thanks for the questions to Jackie. Look, this is a long-term project, and it is something that we absolutely need. And I think one of the things about having it at all will mean that it will generate interest in other things, and actually even putting it into the public domain has started to do that. I've had calls and emails from lots of people who want to be involved, who can be potential partners. I've been quite surprised at how quickly that came up. So that sort of makes me feel more confident that we're actually on the right path. We did used to have care homes at Shawswood in Strood and at what's now called the Rochester Care Home, Robert Bean Lodge in Pattons Lane. Selling them was a mistake. There's no question about that. You're right, Douglas. We should be a gold standard, and we should be, offering that to everybody else. And by doing that, bringing them up along with us. Councillor Wildey, you're right. It does need to be a large facility. It does need to be able to be flexible. And importantly, it needs to deal with different groups of people. This is not just something for older people. Where we're really short of provision is for those working age adults with long-term care needs, and we haven't got anything like enough supported living. So almost, when we choose the location, I'm hoping that we can have some extra care type facilities, but actually that are multi-age, not just aimed at people over 55, and with that bringing a mixed community into the cared for community, which I think would be welcome, but addressing a need for a group of people that we're doing poorly by. And that's particularly important because for some people, younger people in supported living, their needs can change and their independence can grow, and they can get to a position where actually they don't need supported living anymore. But as things stand at the moment, we often haven't got enough supported living for them to go in at all. And if people are ready to move on, we haven't got enough housing that's suitable for them to do that. So actually the reach of this project goes into other things that we're managing with housing colleagues, and it's another one of these things that needs to cut across the council if it's going to be successful. But I'm optimistic. Housing colleagues are really enthusiastic about this too, that will happen.
Thank you, Councillor Murray. Vice Chair. Councillor Nain, sorry.
Thank you. First of all, I'm very happy that you just raised the issue of a mixed community, which I think when it comes to most of these social care homes, we don't often have to see that mixed community. So that's a very good point to raise here. But my bordering is that with us talking about the council not being able to retain a lot of social care workers. Now, if we should come up with such a project, and then currently with the council not being able to retain or to get social care workers to work for the council, how do we think we can get, because if we want to maintain a standard, then we need to get the best within that care home. And having difficulty to get the best, how do you think we can overcome that and get the best so that we can get a standard that my colleague is talking about?
So the conversation earlier on about recruitment and retention was about social workers as opposed to social care workers. So the social workers in my division are the team that do the assessments that says this person needs this type of care, and then it's the social care workers that deliver the care. So there is a challenge nationally with recruiting into the social care workers. What we would look at as part of the Care for Medway approach is making sure that people are paid at a good rate of pay. That's why it's at the moment coming out slightly higher. The national living wage obviously is increasing, so we're seeing a change for people in the care sector receiving an increase in pay. There are some care providers that pay a higher rate than the national living wage, so that would be considered as part of the analysis to look at actually if we wanted to make sure that we'd got a good level of staff that we could retain, what's the rate of pay that needs to be paid to retain them along with the necessary training.
Vice Chair.
I move that the committee notes the report and recommends Cabinet to agree to proceed with commissioning an in-depth analysis of a business case.
Is that seconded? Seconded. Is that agreed, members? Agreed. Thank you very much. And thank you very much, Councillor Murray. You can go now. You've sat here for the 3 long agenda items, so thank you very much for all your input. It's really good. Thank you for all your input. It's really good. Okay, I've got item 7. Yeah, I was going to say item 7. We've now got the integrated care strategy update. David.
Thank you very much. There are 2 important documents that guide what we do to improve health and wellbeing in Medway. One is the Kent and Medway Integrated Care Strategy, and the other is Medway's Joint Local Health and Wellbeing Strategy. These 2 strategies were developed in tandem, which meant that we were able to feed ideas from one across to the other and ensure that they were working together and complemented each other. So, for example, we did some quite extensive work on engagement within Medway, and we were able to use that to feed into the integrated care strategy. The Kent and Medway Integrated Care Strategy has 6 outcomes that provide the framework for the whole of Kent and Medway, while the Medway Joint Local Health and Wellbeing Strategy gives us this lens, this Medway-specific lens, and it's the strategy of the Health and Wellbeing Board. So today's focus is on the Integrated Care Strategy for the whole of Kent and Medway. To deliver the strategy, we have developed a shared delivery plan, and this has been brought to HASC previously. And the focus of today's paper is on the logical framework matrix, or log frame, that we're using to tell us at a strategic level whether or not we are delivering the outcomes of the integrated care strategy. And when I say we, it's important to note that the we is the system working together. So that's Medway Council, Kent County Council, and the NHS, the ICB, but also different partners as well across Kent and Medway, including the voluntary sector. The log frame has a number of indicators in that, and we needed to strike the balance, to get the balance right, to ensure that they were sufficiently comprehensive to cover all the outcomes, but didn't include so many different indicators that the Integrated Care Partnership would be overwhelmed with data and get lost in the detail. The indicators in the log frame are largely strategic outcome indicators, and we've tried to avoid putting operational indicators in there, because, as I said, it's about monitoring the strategic level whether or not we're delivering the outcomes. Many of the indicators use external sources, and many of those are only updated annually. So it's about the big picture. It's not about micromanaging the operational side of delivery. And when viewing the log frame, it's important to remember that the objective of the strategy is to deliver the outcomes and not the indicators. So the indicators tell us whether or not we're delivering the outcomes. So the focus is on the outcomes. The Integrated Care Partnership has 4 meetings each year, and our plan is to take 2 of the outcomes to each of the Integrated Care Partnership meetings, so that the Integrated Care Partnership can look at the indicators in detail. And we'll also be focusing on 1 or 2 key issues that have been identified as part of the process of preparing for those meetings, and then bring along subject matter experts to discuss those particular issues in a little bit more detail and be there so that the Integrated Care Partnership can ask further questions about those particular topics. And then at the end of the year, for the 4th meeting, we would have a complete review of the whole log frame. I think that covers the key elements of the paper. And we have Rachel Hewitt here, who is the Acting Chief Strategy and Partnership Officer from the ICB, and myself. We worked closely together on developing the Integrated Care Strategy and the delivery plan and the log frame, and we're happy to take questions.
Thank you very much, David. Obviously, it's a good report, good detailed report that I'm sure members have dug into. Any questions from our members? Councillor Waddy? Your microphone, Councillor Waddy.
as I always say, I'm better without it. It is a very good detailed report. On page 126, this is on children, so I don't know if you're happy for me to ask the questions, but especially on 1.2, healthy weight.
Sorry, Councillor Wiley, I don't really want to go into children at this one, because this is going to go to them as well, if we can.
As this is a very good positive for Medway, if I can just comment on this one, and then I'll move on. Healthy weight, Kent has improved by 0.7%, whereas Medway has improved by 3.5%. I think, we should thank our, healthy team, your team, for any statistics like that. Moving on to more adults, a little bit more disappointing. Only 67% of patients with long-term conditions say they've had enough support. That's not a very good statistic, and hopefully that one will be looked at. And there was a few others. Yes, at 5.5, by 2028, the percentage of patients spending more than 12 hours in an emergency department before admission matches their performance nearest neighbours. I think that's speeding up A&E times. I think that's quite important. And there is one in here about the percentage of people that are happy with a GP getting to see a GP, which is still very low. It was 49%, and we're hoping it's going to go up to 60%, which to me is not good enough. As I always say, we need more GPs in Medway, and that, to me, that statistic should be looked at, should be worked at, and, needs to improve. Thank you. And don't look so bored just because I always harp on the same subject. Thank you.
And so, yeah, that's fine. And, I'm not going to curtail you, Councillor Wiley. I think it's just about, is it more comments you're making there rather than the questions? I think, because what's the main question out of them bits that you'd like the team to answer?
David was saying they would take the important issues to other boards, and I think they are...
So for noting. Yeah, okay.
Yes.
No, that's perfect.
The children's one was simply because Medway's doing so good, and we should all promote that.
Sure. So,
okay, thank you.
So David and the team, you'll note that for... Is that right? Yep. Fantastic. Okay. I suppose my only question... A quite important question. I suppose it goes on from the past with the ICB and how we stay on top of things. It's a question that was asked to me by the chair from the hospital as well, who also sits on these boards in some way or another. I suppose for this committee, I need to know how we're going to keep on top of this to keep it reviewed. Because, they all go off, we can say yes to this, it all goes off. I need to know what your suggestion would be about a regular review for us here on HAS to look at this detail. I don't want it just disappearing off when we get it in a year's time. I'm not speaking on behalf of members, but I don't think that would be accepted, because a lot of stuff will be going on again and we won't get, even good stuff, but we won't get an eye on it. And I think we need to have an eye on this going forward. So, any suggestions as to... Go on, Dave.
So my immediate thoughts around that are that, as I said, we will be taking 2 of the outcomes to the Integrated Care Partnership at each meeting. There are 4 meetings throughout the year. So that will involve a report with the indicators relevant for those 2 outcomes, plus the information related to the more in-depth work. And then there will be the ICP meeting itself, where there will be discussion about those issues. From that, there will then be a report summarising that meeting. So maybe at that point, that report, complete with everything, comes back to HASC. So HASC can then get to see what the indicators are saying, plus what the ICP has discussed about it and what the organisations are then planning to do.
I mean, I think that's a good idea. I think, you know, just to put it clear, we want you to get on with the work. We don't want to, you know, we don't want to stop you getting on with the work and the good stuff in that. I think from what we were saying or from what we learned before, I think a 6 monthly update would be good. So in 6 months' time, get an update on where we are. Especially, you know, the comments from Councillor Wiley and others through the whole evening tonight. You see there's a real passion for health and a real passion for change. So, and I'm sure the ICB would be happy to do. Do you want to? I'll give you a chance to comment. After sitting here all evening, I've got to give you a chance.
Absolutely, yes, we would. And as David said, I do think it's important to bring a fuller discussion than just some of the metrics, so you can hear exactly what's going on behind it once we get further into it. And yes, we would very much welcome coming back. Thank you.
And it's the challenges, the obstacles, as well as, you know, it's not all about the good stuff. It's about where the gaps are and the challenges. But again, a really good report, so a really thorough. So thank you very much for that. Vice Chair.
I move that the committee notes the Integrated Care Strategy Baseline Report and the approach that the Integrated Care Partnership will be taking to review progress across each of the 6 themes over each year.
Seconded, members? Seconded and agreed. Agreed. Thank you very much. Thank you so much for coming. Thank you so much for that. No pressure, Terry. Item 8. Kent and Medway Joint NHS Overview and Scrutiny Committee. In terms of reference, we've had some very exciting meetings on this, haven't we?
We have. Thank you, Chair. This is quite a procedural report. As members are aware, when health services impact more than one local authority area, we have to set up a joint overview and scrutiny committee. We have one set up with Kent, but it only really meets when both us and Kent will decide something's an SV. The committee were advised last year that the powers around referring a proposal to the Secretary of State changed. They were removed, and the power now sits with the Secretary of State. He has the power, she has the power to call a proposal in, and anybody can request the Secretary of State to do so, but they can't require it. The report itself sets out 2 options in relation to the requesting the Secretary of State to call in a proposal and then responding to representations on a called-in reconfiguration. One option is that that stays with with our own local authorities, and the other option is that that's given to the joint HOSC. Given that the joint HOSC will have carried out the scrutiny of a particular proposal if it's cross-boundary, because that's what we have to do, it makes sense for that body to be the one that does those things in the first instance. By doing it as an individual health scrutiny committee could actually weaken and have a less of an influence in terms of those representations or that request going forward. However, because anybody can request the Secretary of State to do that, if the joint HOSC, for example, decided not to request the Secretary of State to call something in, Medway or Kent could still do so if they wished to. So there's always still that backup plan. So in terms of the recommendations you're being asked to look at the options at 6.3 and 6.4. It's recommended the committee goes with option B in both cases because that's the strongest position if the joint HOSC agrees, and if it doesn't, Medway can still do what it wants to anyway. That is what the Kent HOSC have indicated their wishes are at their meeting in December. Depending on what the committee decides tonight, we will then draft an updated terms of reference, which will then go to full council in April for approval. Happy to take any questions.
Thank you, Terry. And just for the for the record, obviously, we had really good positive meetings with Kent on this and the Democratic Services in Kent as well. And I know that Terry's also met with Councillor Wiley and Councillor Crozier and updated them as well. So we wanted to put in that safety barrier. It makes sense, us working together, but we wanted a safety barrier that if they didn't agree, we can still go off and do what we wanted to do anyway. Hopefully they would agree with any things that we... let's go on, Councillor Wiley.
Yeah, I agree that option B is the way for us to go. I do have concerns that if we consider something an SV and Kent don't, so that it doesn't go to a joint HOSC, the Secretary of State will still look at that, as you say, with a lower lower influence from our point of view, because because Kent didn't agree that it was an SV. That does seem a shame, but that's the way it's written. So option B, it's got to be.
I think there is some work around the SV element, which I have sort of touched on with my counterpart at KCC. And I've talked a lot about working towards setting up a memorandum of understanding between us, Kent, and the ICB in particular, in terms of how we look at things and how we decide whether something's an SV, so that hopefully we could become a bit more aligned on that. So that is a concern. It's something that I think we hopefully could work through in terms of developing that memorandum of understanding, which both the ICB and KCC are supportive of in principle.
And I think also, and thanks to Councillor Wiley, I think also, I know Councillor Murray with the LGA, etc., I also feel that it's a point, the SV is pretty weak in some places anyway. The SV doesn't always do or reflect what a community wants from, and doesn't always listen. The old SV even, and it's been something that's been around for a while. So, I don't know if there's any work, and Councillor Murray, you might be able to have a look, keep your ear out and see what's happening, if there's any changes with our SV procedure when a community, and I suppose devolution will change things anyway. So, but if there's an SV and a community feels like they're losing its services, it'd be nice to know in the future there might be something in the pipeline to strengthen that. I don't know, from your LGA, sorry, I'm calling you back in now.
Just responding quickly to that, that's a really important thing, because one of the things about devolution is that there's a very genuine ask for ideas and impact to be fed up the line. And that's a really good example of how the whole process might miss something that's really important to us. So, yeah, very happy to feed that back up.
Okay, so Vice Chair.
I move that the committee notes the report and recommends that the terms of reference as set out at Appendix 1 be updated to reflect option B within section 6.3 and 6.4.
Seconded? Fantastic. Agreed? Agreed. Thank you very much. Thank you. That's passed. Terry, work programme, please.
Thank you, Chair. I have nothing really to add to the work programme report, but happy to take any questions. Thank you.
I have one thing to add to the work programme. I'm sorry, one small thing. It's a very positive thing. I already said to you that Terry and I are working on this really good, and Councillor Hammond-Dishay would definitely agree with me, because he's talking about, he loves that training, and I know Councillor Cook does as well. You're going to be getting an email through with a whole programme of provider training, visits, everything through. Please answer the email when they come through from Terry. We will go ahead with them provider forums. The ICB are doing a big programme with us as well. Please go ahead with, even if we're going to go ahead, even if there's only a few members, but I'd love all members as best we can to try and get on those. It's a new thing we're doing, the Scrutiny, and I think that outside informal training is a really good programme, and it just opens the door to you into those organisations, and allows us to be much more effective here, although you're all very effective already, much more effective on this committee to scrutinise. So Terry's going to be doing a lot of work on that, so please, well, Terry will nag you anyway, so I'm convinced it'll be no problem. Okay, Vice Chair.
I move that the committee notes the report and agrees the work programme as set out at Appendix 1 to the report, subject to accepting the proposed changes outlined in italic text on Appendix 1.
Seconded? Seconded, members? And agreed. Agreed. Thank you, members, and good evening. That's the end of the meeting. Thank you very much. Thank you.